everyone for joining us.
Folks, I'm really sorry.
Chair, we're ready to go.
All right, can everyone hear me?
Yes.
Yes, okay. I'm sorry, I don't know what's actually going on, but at least I can get through on this. All right, so are we ready to start like in what, 1 minute?
We are ready now.
Okay, great. Hi, I'd like to call to order the December 14th, 2021 meeting of the Human Services Commission. Can Stephen say the Pledge of Allegiance, please?
I pledge allegiance to the flag for the United States of America. And I forgot.
And to the republic
For which it stands,
one nation, indivisible, with liberty and justice
for some. Thank you, Barbara, for helping me.
Okay, folks, just be a little bit patient with me. I've never used my phone for this, and I'm seeing some of you and not all of you. Can we get a roll call, please?
Yes. Commissioner Byers?
Present.
Commissioner Darvish?
Aye.
Commissioner Davis?
Here.
Commissioner Freiberg?
Here.
Commissioner Shandrick?
Yes.
Vice Chair Meltzer?
here.
Chair Palmieri?
Yes.
We have a quorum. Thank you.
Thank you. Can we get a motion to approve the minutes, or are there any corrections?
Chair,
Oh,
my apologies.
I'm sorry.
Yes,
I'm
the
sorry, I'm
agenda.
sorry. Okay, approval of agenda, including the consent calendar. Can I get a motion to approve the agenda?
So moved.
Second.
Stephen moved, second by Barbara, I believe.
Yes.
I have a quick question. I would like to close the meeting in honor of someone, and so sometimes we do it in the front, sometimes we do it in the back. Should I just wait for Commissioner
So
comments?
I think we're going to wait till Commissioner comments, and then
Okay.
anyone that has anyone
That'd
to adjourn in. Okay.
Thank you, Jimmy.
Thanks. Can we get an approval of the minutes, or are there any changes to it?
Chair, I'm going to do roll call on the agenda approval.
Okay. Folks, I'm sorry. I'm not stressing over this.
It's okay. You're doing great. Commissioner Myers?
Yes.
Commissioner Darvish?
Yes.
Commissioner Davis?
Yes.
Commissioner Freiberg?
Aye.
Commissioner Shandrick?
Yes.
Vice Chair Meltzer?
Yes.
Chair Palmieri?
Yes.
Thank you.
And now we can move on to the approval of the minutes. Does someone want to make a motion, or are there any corrections?
I'll make a motion.
I actually have one correction. I nominated Vice Chair Meltzer, and I believe Commissioner Davis seconded that. Can you please make that for the record? And I double checked; it's on the video. I wanted to make sure that I was okay with that.
I support that because
Any
I
other
didn't do it.
corrections? Any other corrections? No. Can I get a motion to approve the minutes?
I'll make a motion.
Commissioner Darvish, can I get a second? Somebody just say it out loud.
Second,
Okay, was that Stephen?
Commissioner Davis, yeah.
Okay, so Commissioner Darvish and Commissioner Davis second. Can you get a roll?
Commissioner Myers?
Yes.
Commissioner Darvish?
Yes.
Commissioner Davis?
Not paying attention. Here.
Commissioner Freiberg?
Aye.
Commissioner Shandrick?
Yes.
Vice Chair Meltzer?
Yes.
And Chair Palmieri?
Yes.
Thank you so much.
So we're going to move on to public comment, but I want to apologize to anyone that is in the audience and to the other commissioners and staff. This is the first time I'm using my phone. For some reason, my computer is not working. So just bear with me because I can't see all of you at once. Can we go to public comment? Jenny, I believe you said there were two.
We currently have two, and I believe we have a third one in the waiting room. The first public comment will be David Nash. The second public comment will be Yola Dor. And the third public comment will be Dean Abroshi, and everyone has 3 minutes. We can start with David. David, if you could please go on camera and mute yourself. David, are you in the room? I'm asking you to unmute. If you might get a pop-up and asking you to go on video. David, are you in the room? Okay, so we're going to move on to Yola.
Unmuted.
Okay. Hi, David.
Hi.
If you wanted to go on camera, you're more than welcome to. Otherwise, I'll start the time now. Thank you so much for joining us tonight.
All right. I think it's better if I just talk since you can hear me.
Great.
My name is David Nash. I am on the Disability Advisory Board, but I'm not speaking on their behalf. I'm speaking as an individual and advocating for something that's long been near and dear to my heart. I'd like to see the city take steps to simplify and consolidate applications to different agencies for public services. The process of gathering the documentation, starting with proof of income from Social Security, proof of residence, a copy of your driver's license, all those pieces that are required from each agency can be extremely difficult for a person who has a disability, mental health issue, or imagine an 82-year-old senior trying to access and process those pieces of information. It's just almost impossible. Even though I'm slightly functional, I'm at an age where when I went to college, I was on a typewriter. So anything involving copying, emailing, faxing is all very difficult. There are so many wonderful social service agencies that are all independent. It becomes very problematic to provide that information individually and repeatedly. I'm hoping that the city can somehow step up to the plate, as some other cities have done, as in the case of San Francisco. I believe it happened 20 years ago. There's the option of a data bank being created where one's information is held. And if you're approved, for example, for a CalFresh card, that should automatically enroll you in other services such as Disability Community Resource Center, Project Angel Food, Jewish Family Services. I know there are complications that extend from the federal, state, county, and city level, but I urge the Human Services Commission to take into consideration, to take steps to move forward, to streamline the process, to allow ease of access. Otherwise, you'll have, like I have currently, a neighbor who's been in a disabled-only building for 3 months and has yet to have one service activated. It's just so daunting a process to collect all that information, including repeated verification of one's HIV status, which doesn't change over the years as there is no cure. I've had conversations with David Juni, with Derek
David,
Murray.
thank you so much. It's been 3 minutes. I'm so sorry.
Thank
Thank you very much.
I know you'll take steps to streamline this process. Thank you so much for hearing me.
Thank you so
Thank you.
much. Yola, you ready for your public comment? You have 3 minutes.
Yes, ma'am, I am. Good evening, Chair, Vice Chair, Commissioners, staff, and any guest. I'm Yola Dore. I'm your official liaisons person from the Disabilities Advisory Board. I'm not only speaking for the board tonight, but for the many citizens that you have helped throughout this pandemic by the work you do and the staff. You have just done an exemplary job. And this holiday, I find myself as an individual, not as the board, very grateful for the work you've done with the agencies that you have decided to fund, namely Jewish Family Services, Project Angel Food, that helped out during the time when many seniors and disabled persons found themselves in the situation where food was an issue during this pandemic, where services were needed through counseling and other things. Because of your hard work, many of our residents were able to get those services. I commend you and the service providers that did these wonderful things. So I'd like to take a moment tonight to say thank you and let you know how grateful I am and the many citizens you have helped through your work this holiday season. I hope your holiday, whichever ones you celebrate, are blessed, healthy, and safe. Thank you so much.
Thank you, Yola. Do we have a third?
Dean, if you wanted to unmute yourself and go on camera, we'd love to hear your public comment.
All right. Thank you. Good evening. My name is Dean Ambrosini. I'm with the West Hollywood Project through the Institute for Public Strategies and the Safe West Hollywood Community Coalition. IPS is the substance abuse prevention provider for SPA 4 in LA County, which includes the city of West Hollywood. And I'm here tonight to speak in favor of increased access and funding for harm reduction programs as a life-saving measure to combat drug-related deaths in the city. Harm reduction programs are controversial and mired in stigma. At first glance, they appear to be enabling drug use, which creates immediate resistance. In looking at harm reduction as it evolves, we need to look past the stigma and consider the benefits and weigh them against the advantages. The earliest form of harm reduction began with syringe exchange programs in the 1980s and 90s to help curb HIV infections among people who inject drugs. Government agencies were resistant to establishing these programs because they enabled drug use. 35 years later, we have seen that syringe exchange programs were instrumental in reducing the spread of HIV. In spite of this and the fact that harm reduction has evolved into a multi-level strategy, that stigma has continued to proliferate, which makes public support difficult to attain. This stigma is damaging on many levels. It allows the problem to continue to exist with no control because of unfounded fears to try a new method. And it continues to allow diseases such as hepatitis A, B, and C, as well as HIV, to continue to spread. And worse, it denies people who use drugs access to care which can help improve their overall health. Harm reduction cannot be taken at face value. We need to look deeper. Harm reduction does meet active drug users where they are and makes them their own agents for change. It gives people who use drugs a less damaging methods of use, which can slow the impact of prolonged drug use. These programs also act as points of engagement for people who use drugs, providing them with access to healthcare and tools to stop altogether. Ideas which seem contrary to public health when examined as harm reduction tactics can actually be beneficial when they're compared to a more dangerous alternative. It's vital that we break down and break free of the stigma surrounding harm reduction as we see the benefits played out in improved health outcomes. Public education needs to be part of any implementation strategy in harm reduction in order to help change the public perception of drug use and addiction. Getting the public to understand the benefits of harm reduction is an important step in furthering the benefits of these programs. Challenging belief systems which lead to knee-jerk reaction through education will help bring about a more broad-minded approach to public health. Thank you very much.
Thank you, Dean. Is there anyone else?
Hello, everyone. This is your secretary. If you have a public comment, please make sure to use the raised hand feature. It looks like we have Sarah Blench in the room and she has her hand raised. Would you please unmute yourself and go on camera if you choose to?
Yes, thank you. Good evening, everyone. Thanks for hearing me. My name is Sarah Blanche, and I am with the West Hollywood Project and the Safe West Hollywood Community Coalition. We're a group working to reduce drug and alcohol-related harms in West Hollywood. And I also am here tonight to discuss the positive impacts of increasing access to harm reduction services and syringe service programs, or SSPs, in West Hollywood. Despite the controversy, harm reduction programs have really shown great success in combating drug-related harms in communities that do have active programs. Data show that such programs help to reduce HIV and other sexually transmitted diseases by more than 50%. And according to the CDC, there has been a decrease in HIV diagnoses attributable to injection drug use since the 1990s, when syringe exchange program first began. And equally as important, harm reduction and syringe exchange programs really do facilitate entry into treatment for people experiencing substance use disorders. And people who use syringe exchange generally have high readiness to reduce or to stop their drug use. Syringe service programs can reduce overdose deaths by teaching people how to inject drugs, how to prevent and respond to a drug overdose, providing them training on how to use Naloxone, a medication to reverse overdose, and providing Naloxone to them. Harm reduction programs, including syringe service programs, have been around for more than 30 years, and the results really are clear. These programs make a significant impact on improving health outcomes for people who inject drugs. Data show that increased harm reduction services in WeHo could provide great benefits. Thank you.
Thank you, Sarah. Is there anyone else?
Not at this time. If we have any other public comments, can you please use the raise your hand feature?
Okay.
Chair, I think we're good to move forward.
Great. We will move on to unfinished business 3A. Presentation from staff of the Coalition for Economic Survival, CES. And I believe that's going to David. And then it will go to Eugene.
We can go straight to Eugene, and I'll risk mispronunciation. I think it's Eugene Macy.
Mayscott.
Mayscott. Thank you, Eugene.
Thank you, David.
Turning it over to you.
Good evening, everybody. Thank you, Chair Palmieri, Vice Chair Meltzer, commissioners, and city staff members. I really appreciate this chance, you welcoming me to meeting and allowing me the chance to provide you with this information and update on the work we do. I'm Eugene Meska. I am your tenant outreach organizer for Coalition for Economic Survival, CES. We are a 40-year-old multiracial, multicultural, grassroots, community-based nonprofit organization assisting, organizing, and empowering low and moderate income renters in West Hollywood, Los Angeles, and all over Southern California. CES helped create City of West Hollywood, led the effort to win rent control laws in West Hollywood and Los Angeles, and most local laws that protect tenants to this day. CES achieved all of that because of the participation of tenants. We encourage all tenants, everybody who's living in rent-stabilized, low or moderate income housing in West Hollywood, to become CES members and join 6,000 plus tenants all over Southern California because we believe in power in numbers and believe also in standing up for each other. Our focus always have been and currently includes issues like protecting rent control, combating slumlord housing conditions, stopping unjust evictions and displacement of tenants, protecting neighborhoods against gentrification, preserving government-assisted low-cost housing, eradicating housing dangers such as exposure to lead paint poisoning, and advocating for new affordable housing through political and legislative initiatives, and many others. I actually appreciate this chance to address the commission and bring your attention to some of the most critical problems that we've been battling in our community, including growing number of evictions and attempts to evict tenants and lots of cases of tenant harassment. I'm currently working with a lot of cases where long-term RSO tenants are being pushed out by all means necessary from their RSO tenancy. We're talking about low-income, disabled, elderly tenants and tenants being discriminated because of their sexual orientation, age, race, disability, gender, national origin, health conditions, medical diagnosis, or other situations. So recently we had cases when landlords went as far as filing frivolous lawsuits in civil court as one of the scare tactics to force tenants out. And of course, they still deploy all the oldies but goodies like intimidations, denial of repairs and maintenance, cash for keys, harassment, decrease of services, and many other tactics and obvious old tricks. So what are we doing to help? In collaboration with the City of West Hollywood, CES provides all residents of West Hollywood with free services. And I would like to take a couple of minutes to basically talk to you about services we provide. CES and West Hollywood are doing monthly town hall educational forums via Zoom, where representatives from City Rent Stabilization Division and CES talk about the most important current issues and answer tenants' questions. Also, in the last several months, due to growing demand for informational help and legal support, we have added a second legal clinic. So now every Wednesday at 6 p.m., we have an exclusive West Hollywood CES Tenants' Rights Zoom clinic where anybody can register online and get a free one-on-one consultation with the best tenants' rights attorneys via Zoom from the comfort of their home. That touches also on accessibility for residents who previously weren't able to attend clinic, and I will come back to that in a moment. And of course, we're continuing our traditional Saturday morning CES Tenants' Rights Zoom clinics at 10 a.m. With even more possibilities right now and even more new attorneys available to the tenants that we added. It's been around for 48 years now. Usually I'm doing the intake with tenants before the clinic. I am also following up with tenants after the consultation with attorneys and the advice they receive. I'm connecting them after that to city divisions and services like code compliance, rent stabilization, or mediation service, or other nonprofits that I've been actively building relationships with, like GFS, Trans-Latina Coalition, JVS, WehoWorks, Lgbt Center, APIT, St. John's, and others. I also have an ability to provide tenants who come to us for help with direct referral to Beth Sadek, a law firm that contracted with the City of West Hollywood, to provide them with free legal services and more in-depth legal advice and full representation if they require it. And when tenants need to file a tenant harassment complaint or fill out the rent decrease form, fill out the rent relief or recertification on housing scheme for rent relief, I'm guiding them through the process over the phone and make sure they collect all documentation they need and all the evidence required. That often happens with tenants with disabilities, and I'm here to help with whatever they need to make sure that they have equal access to all our services and more. Speaking of equal access, we now officially provide language support in Russian, Spanish, Farsi, and Hebrew. We also provide special accommodations during tenants association Zoom meetings and tenants' rights Zoom clinics. For example, we have tested and successfully deployed live transcription services, which we are kind of really proud of, to support our deaf tenants during weekly tenants association Zoom meetings, which we have several each week. And also the same live transcription services are available and are on deck during each tenants' rights Zoom clinic twice a week. And going back again to accessibility, I would like to mention that all of our services have easy accessibility via Zoom or phone from the comfort of tenants' homes. Also, we're making considerable efforts when it comes to the digital divide and making sure that all tenants can access our services. So, in conclusion, basically, I want to make sure that all of you know that we are the resource that all of you can recommend and send people to. So if you know anybody who needs help, who is being harassed by the landlord, or who is being unlawfully evicted, especially during the moratorium, we have a very strong tenant harassment ordinance that came in power and was adopted by our amazing city council. It came in power on August 18th. So let's use the ordinances we have and laws we have to protect our tenants. And you can send our residents to me. I will give you my direct phone line. It's 213-252.
So maybe you can give that to staff. Maybe you can give that to staff and then staff. Maybe you can give that to staff and then staff can forward it to us.
Yes, absolutely. I will do that too. And also, I have an email address. I'm sorry?
And include all of your information and staff can forward that to us. This way we have it exact.
Yeah, absolutely. Let's do that. Okay. So I actually pick up my phone.
Thank you so much for your presentation. Great. Thank you so much for your presentation. A lot of great information. Do any of the commissioners have any questions that you might have?
I'll be happy to answer any questions that any of the commissioners have, please.
Great. I'm just going to flip through and say, okay, Commissioner Darvish, I see your hand.
I have a quick question about what you mentioned during pandemic or non-pandemic when a tenant was pushed out, you know, sort of against the guidelines or illegally. I was just wondering, that came up before. Wouldn't that the process goes through the city, I thought? So how does that happen if you have a guideline and the landlord has to file through the city, right, to get rid of the tenant? So does that happen? Can they bypass the city?
So the situation with landlords, I can tell you one thing. Nothing stops them from trying. And that's been the case ever since they, I guess, started renting. And the situation is we can just make sure that tenants actually use all the ordinances that we have in place and all the laws that we have in place to protect them. So if landlord is doing something illegal, like trying to evict something during the COVID moratorium, landlord can try to put some notice on their door. It doesn't mean that notice is legal, but it can still scare tenants. It can be a part of the harassment tactics. It can be a part of them just trying to push the tenants out. What if they believe the notice? Some tenants actually believed the notice and moved out without contacting the city or contacting us. So this is why we need to promote that we exist, that we are here, and we're here to help. And this is why I've been going around and telling all our boards and commissions, guys, let's give this information to all the constituency. This is very important. This is why we're doing town hall educational forums, because a lot of tenants don't know how we work and what we can provide, which is help and support.
Great, that sounds great. Can you please, is there anyone else that would like to?
Chair Palmieri, I'm sharing my screen with Eugene's information for anyone who's watching this meeting on YouTube.
Thank you so much.
You could see his phone number and email on the screen.
I appreciate it. Thank you.
Of course, you're welcome. I'm just going to leave it on for another 10 seconds for folks who are watching from YouTube.
Okay,
And I
so
pick
with
up my
that, I
phone,
lost
so
my,
you can call me and I will guide you through the process, whatever you need. If you need to connect to the city division, or if you need to come to our clinic, I will help you with your issue. So just make sure that you get help, okay?
thank you very much. So when you shared the screen, I lost my screen, so I don't know if you're seeing me or not at this point. Can you even hear me?
Yes,
Chair,
we can hear you.
we can hear you.
Okay, I can't find my screen, so I'm just gonna have to do without it. I don't want to hold this meeting up any longer.
Chair, I'm
next-
asking you to go on camera. Do you see it pop up on your phone?
I do, it's just not going on.
There you go.
Can you see me? Because I can't see anybody. As long as
Yes,
you
we
can see
can
me,
see
I
you.
don't care. I'll just, okay, perfect. All right, the next we have is,
Chair
are there
Palmieri, could I,
any other questions?
just
Are there any
real
other
quick,
questions? I'm sorry.
yeah, sure, yes, please. Just discussing Mr. Maskey's presentation on evictions and rent relief. David, can you remind us when the eviction moratorium extension ends? I think we just did a recent extension, and I just thought that information would be helpful, or if Eugene, you could chime in.
As of right now, end of January. The last extension by City Council was until the end of January 2022. And I think that
Thank you very much. That's
yeah, of
that's
course.
my only question.
Of course. If anybody has any questions, I'm always happy to answer your questions.
Thank you, Eugene. Chair Palmieri, can you hear us?
Can you hear me?
Yes.
I'm really sorry, folks. Something happened when you shared the screen with my phone. Okay, unfinished business, 2021 year report on social service programming. That goes to David, and I will try to fix my screen as soon as possible.
So good evening, commissioners. I'm David Juni. I'm the manager of the city's social services division. And this is the year-end report on social services programs for the 2020-2021 contract year. As you are aware, this ends the second year of the 3-year funding cycle. It's 2019 through 2022. So I'm going to, I hope this doesn't mess up the chair, but I am going to share my screen. I'm going to briefly go through attachment C, which is the client demographics, just to illustrate to the commission and to the audience who accessed services this year. And before I start, I wanted to say thank you again to all of the agencies that provide services. And we've got many representatives here today and for this evening's meeting. In preparing for tonight's presentation, I realized that this time last year, when we gave the year-end report, it reflected 6 months of impacts from COVID. So, and I think myself and others maybe naively or foolishly thought that maybe we were getting through to the other side. And so here we are, and this report reflects 12 months of a pretty phenomenal impact on service provision by COVID. So I can't say thank you enough to the agencies for standing up to the challenges. It has been challenging, for keeping your staff safe, for always keeping our community members safe. And with that, I'll dive into the demographics. This is going to be brief, and then I'll turn it over to Les and the program administrators. So can you see my screen? Hopefully.
Yes, we can.
Okay, so here we go. Age of clients served. You will see, and we have addressed, and we will look at in the new contract year, splitting up some of these cohorts. I know folks had concerns that they were too broad, but we're being consistent throughout this contract cycle. So as you see, once again, the most frequent access, and we're serving the most community members in the 24 to 39 age bracket. As you will see demonstrated through this, it's largely due to access to HIV and sexual health services, which draw big numbers. So these numbers were pretty consistent. 4% of clients accessing services were under the age of 24, 31% of clients between 24 and 39, 27% between 40 and 59, 38% over the age of 60. That was very consistent with last year at this time. Now, by client gender, we have community members who identify as men account for 60% of the individuals served by our providers. That's actually up 3% from the year end last year. Women accounted for 38% of access to services, and sure enough, that was the corresponding, that decreased by 3% from last year. Gender information was unknown for 2% of the clients, same as last year. Client age by gender, once again, you see in that 24 to 39 age range, you see the high number of men or community members who identify male, which are represented by the blue bar. There's 1,788 access services. You'll see later that's largely HIV and sexual health services, or a big portion of that is those services. Then you see the next age range is the 40 to 59 had large segments of the community accessing services. As our community members age, it begins to level out access to service by folks who identify either male or female. And as you'll see in the older age ranges, 70 to 79 and 80 plus, the number of community members identifying female outpaces the number of men who access services. As far as client ethnicity, 64% of the community members accessing services identify as white. That was actually down slightly, it was down 2% from last year. Hispanics accounted for 13% of individuals served. That was up, that corresponding 2% from last year. The other percentages remain the same. 7% identified as Black, and then 16% was a combination of Asian Pacific Islander, Native American, and other. Household language, 78% of the clients served identified English as their household language. That was a big jump from last year. It was up 10%. We had 15% of clients identified Russian as their household language, down 8% from last year. The others were pretty consistent. Decrease in 1% of the clients who identified Spanish as their primary language, decrease by 1% for clients who said that neither English, Russian, or Spanish was their household language. Transgender clients served, we had an update to your report. There was a, in the spreadsheet, when we were entering all the data, this comes from the program reports the agencies provide on a quarterly basis. It comes from the cover page, which is our demographic page. We had a formula error in the spreadsheet. And so actually we're happy to report the number in your staff report is incorrect, and it was increased. A total of 273 clients who access services identified as transgender, and that's actually an 11% increase from last year. Of those clients, 165 identified trans female, 37 trans male, and 71 identified non-binary or gender non-conforming. Client gender by service category. This is interesting to see, the discrepancy for community members who identify male or female, the discrepancy in who accesses the services. And I won't go over them all, but if you look at, once again, that HIV sexual health line, the fourth line down, you've got 2,429 males who access the service, 496 female. In the homeless services category, right below that, you've got 363 male, 152 female. In the financial assistance, second one from the top, 253 male, 137 female. Nutrition, 477 male. Flip it, and you've got more women accessing or female accessing those services, 872. And then finally, another big discrepancy in substance abuse, 61 identifying as male and 9 female. This just gives the percentage of access to service by those age range. It's just it's interesting to see at one point in life, folks reach out for services. If you look at that top line, you'll see in that 40 to 59 age range, a big bump in community members who are accessing employment services, 49%. If you go down to that HIV sexual health, once again, you get down to that younger cohort, that 24 to 39, 59% of access to service is that age group. If you go down to the transgender providers, you've got 62% of the access to service are with fairly young community members, 24 to 39. I did want to mention that overall access to service was down this year. I'm going back so I can get that number. At the bottom of this slide, you see that the total clients served this time around was 8,265. That represents a 9% decrease from this time last year. And I do believe that we can reasonably say, as I mentioned at the beginning, we had a year impacted by COVID, and there were many challenges with service provision. I think the agencies did, a stellar job in reaching that many community members. So that's the end of my report. I just wanted to also let you know that in January, we will bring the report of the amount of returned and withheld funds. We've got an estimate of that right now, which is $172,643. Those funds will go towards the supplemental programming that was approved by council in September. We had received supplemental funding in the first year of the contract cycle of about $350,000 for additional services to address some of the more impacted services in the city or initiatives, issues, so homeless services, mental health services, substance abuse treatment, services for our trans community. So that was provided in the first year. It was not renewed in the second and third. So we have dedicated the return funds to those services, and whatever the difference is, we'll go to council and ask for unallocated reserves. We'll bring that detailed report to you in January, and I'm going to turn this report over to Leslie. Thank you.
Our hand.
David, can we stop sharing or?
I have a question on this, and I was wondering if Leslie's presentation was going to move forward away from these particular documents that David was just talking about.
Yes, they'll be reporting on highlights from the agencies that they
May I ask
solicited.
a couple questions to do with this part of the report then before Leslie gets started, or should I wait till everything's done?
Chair Palmieri?
We see you, we don't hear you.
More of us have questions.
calling in.
Maybe
Commissioner
Vice Chair could guide us through this section until Jimmy's up and running.
Yep. I just have really two quick comments or questions about the charting. And David's already addressed one. This won't take more than a minute, but if I forget it now, put it in sequence to later, I won't remember all of it.
Why don't you ask the question?
Okay, just real quick. David, you did say that you were going to change the percentages on the bottom where it says the 18 age brackets, the 18 to 23, 24 to 39, which are too large and don't really tell us enough about the actual age bracket. So you said you were going to do that coming up in the new contract year.
We're going to look at in the new contract cycle.
Okay.
Since we just entered the third year of this contract cycle, we want to be consistent. So when we get into 2022, 23, the first year, we will have revised the age ranges for the agencies to report.
And I was wondering, is there a reason that we only do 80 plus? I've always complained about the other ones, but 80 plus, I'd like, it might be better information if we knew it was 80 and 90 and 100, if it's possible. Unless that makes the chart too unwieldy, but it would be interesting to look at. And 80 plus means a lot. I know many people who are above 80 who are very, very different in their mobility issues, food intake, money, everything. So I think that breaking it down better gives us a better picture.
Noted.
Okay, and then the second question I had was on the household language. You have this big pie chart and you managed to get English, other, and Russian in their colors, but then in the red color, which represents the Spanish, it's empty. So if I were looking at this without just noticing it and seeing down here, it says Russian, Spanish, English, other. It does have color coordinations, but I was curious as to know if we can't rectify that and put Spanish in the actual circle or pie chart instead of having like a red and just nothing.
Absolutely. I don't know if there was an issue with just because of the size of the space, but yes, we will be sure to do that.
It may be the size of the space, but I'm going to have great belief in the fact that you guys will figure out a clever way to do that. You know, maybe you can reduce the English speaking part or something. I'm not sure. But those were the two questions, Madam Vice Chair, and I will allow the meeting to continue.
Thank you. Thank you.
Thank you.
Jimmy, are you back?
I can hear. I don't know if you can hear or see me.
Yes, yes. We can hear you.
Okay, so Leslie, are there any other questions? Please just say out loud your name because I can't see anybody yet. Okay,
I
is
think
Leslie
it's
ready?
Leslie's turn. Right. Okay.
I think I interrupted Leslie, and so
I will not hold it against you.
I'm sorry.
All right. Good evening, Chair Palmieri, Vice Chair Meltzer, and Commissioners. As you read in the year-end report on social services, the impact of COVID-19 continues to be a recurring theme with regard to service need and service delivery. In some cases, services reverted to pre-pandemic delivery with some notable modifications to keep clients, staff, and volunteers safe. Jewish Family Services Sova Food Pantry was one of those programs. As service provisions slowly returned to normal, the need for home-delivered groceries decreased, and this past summer, MV Transit discontinued the home-delivered grocery service. Food distribution has resumed at the Pico Robertson Pantry and on-site at the Kings Road building. JVS SoCal's WeHo Works program placed 67 clients in full-time and part-time jobs this year. Despite the challenges to employment brought on by the pandemic, the program reached 84% of its annual goal for job placements. You've heard a lot from us this year about the Emergency Rental Assistance Program administered through the National Council of Jewish Women. They ended this year by providing 140 West Hollywood residents with emergency rental assistance totaling nearly $375,000. And I'm pleased to report that all of those residents remain housed. NCJW's standard rental assistance program had very little activity this year, and that's because nearly everyone applying for rental assistance was referred to the emergency rental assistance program because they were financially impacted by COVID. The West Hollywood preschool operated continuously throughout the contract year, and it enabled parents and guardians to continue to work and provide for their families. Of the 28 children enrolled in the preschool, 17 were fully subsidized, and the remaining 11 children were partially subsidized. Those families paid between $39 and $497 per month for a high-quality, full-day, year-round preschool. Planned Parenthood Los Angeles was able to offer telehealth appointments in addition to in-person services. 100% of West Hollywood patients who tested positive for an STI were successfully notified and received appropriate treatment. Saban Community Clinic saw nearly 3 times as many West Hollywood patients for mental health services than in the previous year. They met the increased demand for service by offering both in-person and telehealth appointments, which increased service capacity. Though dental services were below goal for new clients, they were above goal for patient visits. In addition to routine cleanings, this year the dental clinic provided root canals, tooth extractions, and partial dentures. At this point, I'm going to turn it over to Derek, and myself and the other program administrators will be available to answer questions at the end of our presentations. Thank you.
All right, good evening, commissioners, and I'm hearing a feedback. Okay, I'm not hearing anymore, but good evening, commissioners, members of the public, and providers. So I'll be pretty quick, but I'll try not to go too fast through my list. So starting with the Alliance for Housing and Healing, they're continuing to provide rental assistance for older adults and people living with HIV. The need for emergency COVID-19 related rental assistance, though, is decreasing as more people are either returning back to work or they've received the federal emergency rental assistance through the state of California. For APLA Health, the participation in the HIV Elders Program, HIVE for short, has been really great this past year. For those of you who were able to attend the World AIDS Day event and you saw the poets perform, they're all part of the HIVE program. You're going to hear a little bit later from Being Alive in this agenda. So just to recap, after a slow start in 2020, the syringe services program bounced back and has surpassed its goals for the year. Staff of that program have provided 118 doses of Narcan, and there have been 5 reported saves. And I apologize, my cat wants to go crazy whenever I start talking, so I apologize if he jumps up in the screen. So a save is the process of administering Narcan to someone who's overdosing to save their life. So overall, I apologize. I'm so sorry. Hang on one second. He's like scratching a door. Okay. So where was I? So a save is when somebody is overdosing and staff are able to administer Narcan to save someone's life. So that's incredibly important to have this service. For Betsetics Eviction Defense Program, it's a service that we brought on in 2020 to work with any resident who is threatened with eviction or experiencing harassment from their landlord. As you can tell from the report, the eviction defense attorney has been very busy. The West Hollywood program is unique because it provides full scope representation. A lot of programs that are offered through Stay Housed LA, through other legal service providers, only provide advice and counsel. They don't represent a client in court. So our program is really unique in that way. In Q4, out of the 54 people who were assisted, 46 of them received the full scope representation. And to date, 197 people have entered the program since the program's inception in 2020. Another important highlight is the LGBT Center's mental health services. I don't have to go into too much detail about why it was so important to have mental health services during a life-threatening pandemic, but the center it went fully remote at the beginning of COVID, and they continue to work with patients remotely. The numbers for therapy, psychiatric evaluations, and group support are all exceeding goal. So this shows me that community members are accessing the care that they need. For those of you who have been on the commission for quite a while, you'll notice the huge increase in the number of cisgender women and trans and non-binary people served on this project. So reaching these populations is no longer a challenge like it used to be 4 or 5 years ago. The LGBT Center's sexual health program has been affected by reduced testing services because of the pandemic, and we can see that in the testing numbers. Interestingly enough, as I mentioned in the mid-year, it's the same with the year end, community members are still accessing treatment services at the same levels as they did pre-pandemic. So this signals that there are people still getting tested, but it is a lot less often. The pandemic has negatively affected not just the center, but all of the express testing clinics in 2020 and early 2021. So we'll just have to continue monitoring to see how this reduction in testing will affect the STD crisis moving into 2022. And just another couple of things. In the last contract year, TransCan Work was awarded a $5,000 agency development grant by the city, so that they could hire a grant consultant. And as a result of this $5,000 investment, TransCan Work was able to secure a $500,000, once again, $500,000 grant from the California Workforce Development Board. And with this new funding, they've been able to hire new staff, such as a new program manager, who will be taking over the responsibilities of the program director. So they've been very successful in this last 6 months of the contract, and we can see, how this new funding and new staff are really affecting the WeHo project. This is also, their great numbers is also a result of the economy that's bouncing back. With record jobs being created. So we really hope with this hiring surge that it will lead to more transgender community members finding stable and inclusive employment through TransCan Work. Finally, I'd like to close with a success story from the Trans Latina Coalition. They encountered a 56-year-old trans woman who was living in their car in West Hollywood for several weeks. The person felt safer sleeping in her car because she knew that the city is LGBT friendly. The client was placed into emergency shelter at Trans Latina's Hope House for 2 weeks, and then moved into their transitional housing where she was able to stay for over a month. Just recently, she was able to move in with a roommate, and she's now stabilized, she's employed, and she continues to receive supportive services from Trans Latina. So that concludes my report. I'm happy to answer any questions at the end, and I'm going to turn this over to Joan for her report.
Good evening, Commissioners. I'm Joan Mithers, Social Services Program Administrator. As you've been hearing, this year continued to be defined by our partner agencies' creative responses to service provision during a pandemic. Certain types of services were difficult and programs fell short of goals because of safety limitations. At the same time, other services, usually far more intensive, were highly utilized. DCRC, JFS, and Friends HIV education programs all showed some categories with low numbers, but especially high numbers for case management, where they work patiently and compassionately to address some of the most complicated, challenging, and distressing situations. Programs also responded by changing the way services were provided and adding new services. DCRC obtained funding and was able to provide people with Chromebooks and technology training so that they could access more programs and services. Staff met with people in parks and apartment courtyards, which was sometimes easier for community members than coming to an office. The Friends HIV Education Report shows annual goals for outreach and encounters with men who have sex with men and transgender women. But the progress only reflects the last 6 months of the year. For the first 6 months, Friends implemented a more general and safer outreach program, and that is added in at the bottom of the report scope. So for a full picture, you really have to add both halves of that report together. The Friends Outpatient Treatment Program found that for some people, having virtual meetings and limited in-person hours at their community center actually improved their ability to participate. Seeds of Hope couldn't go into the West Hollywood Community Housing Corporation buildings for in-person cooking or gardening classes, so they produced video classes. There may have been fewer classes because one video serves all buildings, but they reached more people who could watch those videos when it was convenient. For produce distribution, they partnered with the city's transit providers to deliver prepackaged produce boxes to all building residents and sent other homebound community members produce using the county's critical delivery service. McIntyre House continued to be successful, reaching West Hollywood community members. Instead of requiring work-related activities, residents attended online classes with a goal of improved employment in the future. All of the treatment programs, Awakening Recovery, McIntyre House, and Tarzana Treatment Centers implemented COVID safety protocols and were able to keep residents safe. PAWS suspended its volunteer program for safety reasons, but used staff to maintain food and supply deliveries to West Hollywood community members. Early on in the pandemic, the need for food and meals became apparent. The Project Angel Food Emergency Meals program provided more than 165 people with meals since its beginning in 2020. The numbers decreased, this year coming down to a core group of about 55 people by year end. As the emergency program phased out, Project Angel Food transitioned people into ongoing programs, some to JFS, and many to the Project Angel Food ongoing regular program, which ended the year at 146% of the goal. These core groups of people clearly needed assistance, and the pandemic served to get them connected with services. The reports reflect how Project Angel Food exceeded numerical goals, but also noteworthy is the agency's immediate and thorough response to community needs as they emerged. So as we move into the final year of this contract cycle, to say the pandemic has posed challenges is obviously an understatement. But it has also given birth to new ideas and ways of providing services, some of which will be incorporated into programs moving forward. When we hold our planning and coordination meetings with our partner agencies, program staff will have the opportunity to share the innovations and achievements of the last year. It's important right now just to take a minute to acknowledge our partner agencies and the extraordinary services that have been provided during such a challenging year. I will also be available for questions at the end, and we have staff from a number of agencies who are here as well. I'll turn it over to Katie now.
Thank you, Joan, and good evening, commissioners. I will start my update by first turning to the LA LGBT Center's Transgender Economic Empowerment Project, also known as TEEP. Throughout this past year, TEEP staff have been integral in supporting things like Cell Phone Connect Day, which was a repeat event held multiple times this year. Connect Day events brought together government agencies and other service providers to assist unhoused community members in connecting to benefits and discounted cell phone services. Access to cell phones was especially crucial during the pandemic, in order to have our unhoused folks stay connected with their case managers and other support services. While this and the rest of TEEP's work has been incredibly important, the agency has also faced significant challenges and was recently placed on probationary status due to lack of progress towards goal in key service categories, including intake and assessment, outreach and engagement, and case management. As a result, the agency will meet with the city on a bi-weekly basis for program planning and to strategize ways to increase overall service provision. These regular meetings are already underway, and TEEP also participated in a planning and coordination meeting this week with city staff and other agencies. As part of their probationary status, TEEP staff will attend future Human Services Commission meetings to report on their efforts to provide services to more community members. A more detailed update on how these efforts are being implemented will be provided to the Commission in January. Next, I want to highlight the work of GFS Senior Nutrition, which continues to successfully adapt in the face of the ongoing pandemic. As you might recall, in March 2020, Jewish Family Service transitioned all their Congregate Meal clients to delivered meals in order to promote social distancing and abide by the county's limit on public and private gatherings. This change to the program was made possible through the city's partnership with MV Transportation, who were able to provide meal delivery support for JFS due to reduced ridership in the height of the pandemic. However, as MV Transportation ridership began to increase with improved access to vaccines, they became unable to continue with meal delivery. JFS adapted quickly and was able to transition all of their clients who previously received congregate meals at Plummer Park to a grab-and-go meal pickup starting in July 2021. Rather than receiving home-delivered meals, Plummer Park clients can now pick up a week of frozen meals every Tuesday in the park parking lot. Homebound clients, as well as clients living in the Fairfax Towers, West Knoll, and Palms buildings, continue to receive meals delivered to their homes through JFS delivery drivers. And we'll be hearing from Siri Perlman from the JFS Nutrition Program a little bit later in this meeting as well. I'm also excited to report that the Ariadne Getty Senior Housing Development opened this year at the LA LGBT Center. As you may recall, in 2018, City Council allocated $2.1 million from the Affordable Housing Trust Fund to the LGBT Center to support the construction and financing of this 98-unit affordable housing building. As a condition of the city's loan agreement, 13 of the building's units were reserved for individuals on the West Hollywood Inclusionary Housing List. In addition to housing, residents have access to on-site case management and supportive services, as well as an array of fun activities, workshops, and educational programming through the center's senior services program. Of the 13 West Hollywood community members who have moved in so far, 4 have previously experienced homelessness. With older adults becoming the fastest growing age group among people experiencing homelessness in California, this collaboration between the city and the LA LGBT Center highlights some of the crucial work being done at the intersection of the city's Aging in Place and homeless initiatives. It also highlights prevention as an incredibly important tool in our work to end homelessness. As for homeless services, I want to highlight the significant achievements of our agency partners, especially in the face of ongoing pandemic challenges. Congregate shelter settings were greatly impacted by COVID-19 this year. Both the shelter at Essentia and the LA LGBT Center's youth program received recommendations from the Department of Health Services to decompress, meaning that overall bed capacity was reduced to allow for social distancing and other pandemic safety protocols. COVID-19 outbreaks also impacted shelter services, resulting in quarantine periods that prevented new community members from entering the shelter site. Despite these issues, both Essentia and the LGBT Center successfully supported 64 unhoused community members with shelter for a total of 4,275 bed nights. With increased access to vaccines for shelter staff and guests, they've been able to end most decompression practices and return to full or near full capacity. Together with Step Up, Essentia and the LGBT Youth Program have also successfully placed 50 unhoused people into stable housing. These agencies, along with Housing Works, have also provided 88 previously unhoused people with housing retention services this year. And with that, I will wrap up my presentation, and just like my colleagues, I'm available to answer any of your questions. Thank you.
Chair Paul Mary, you're
You're muted.
I think your setting may be. We can see you, but we can't hear you. Did you want to call in to use audio? If you go to, let me text message you the phone number.
Should we go to questions? Does anybody have a question?
Have one.
Please raise your hand. Commissioner Darvish.
Thank you, Vice Chair Meltzer. And I just wanted to commend the staff for amazing job. It's obvious that through the pandemic now for a year and a half, a lot of disruptions and a lot of challenges with, especially with social services and the people connection and how we serve the community. That definitely, I'm sure it was challenging more than we know. So great job there and great report. I just wondered though, as a whole, as we move forward, I guess we talk in our planning session, what we have learned from that. I know shortage of staffing was a challenge for some of those services, as everyone in the industry in the entire country had experienced that. How we can get around that if the pandemic continues, how we can support those agencies or how they could support themselves by reaching out to different avenues. And then the second comment that I had was about the sort of telemedicine or virtual settings that was mentioned. I think Katie mentioned that more than others, but that was very successful. And how do we plan for that? Do we need to invest more into that as a city, or those services are planning to? So those are just the two that I wanted to focus on and get your take. Anyone in the group could answer that. So one was labor challenges, and then one was virtual settings, and what's the future of that if it will continue if the pandemic is over.
Can staff answer that?
So I can start with the
Dave.
virtual, and Leslie might want to join in, but I know there were some advantages to telehealth. And we saw with agencies who have had challenges as far as just facility space, to be able to bring on additional counselors, therapists, mental health professionals, and provide individual counseling virtually, eliminated that challenge. So there were some agencies who were able to increase their staffing and service provision through telehealth.
Yeah, and I will pipe in and tell you that was absolutely the case with Saban Community Clinic. Again, because real estate was such a limitation, and 1 hour, one client in a counseling room pre-pandemic, as opposed to a multitude of like services being able to be offered simultaneously through telehealth. So when I say that Saban Community Clinic saw a significant increase in behavioral health, and Joan noted, or I think it was actually Derek noted it in his comments about the increase in mental health services brought on by a pandemic, the increased anxiety and depression that we feel collectively as a culture was borne out in the services that we contract for, and a lot of our agencies were able to expand those services using that technology. I haven't heard from any of my agencies that they need more to invest in technology. I haven't heard that that's a problem. I think agencies have figured that out. And I'll take a stab at your first question, which is about staffing shortages. And if that's the case, I encourage folks to check in with JVS SoCal's WeHo Works program, which is an employment services program. They have a lot of clients who are looking for work, and that would be a perfect pairing of resources.
Thank you, Leslie. Does that answer your questions, Commissioner Darvish?
Yes, perfect. Thank you so much.
Does anybody else have any questions, comments? Commissioner Davis?
Good evening. It's a nice report. This is about the staff report. I have a couple of questions. On the Disability Community Resource Center talks about home modification needs assessments. I wondered what an example is. Do we have an example of is it like a form that they fill out, or is it something that they have to go into the home? And what is it that they're looking for? So Joan, I can see Joan shaking her head. So yes, Joan.
Well, I have half a response. They have an occupational therapist who goes into the home and does an assessment. And I believe Samantha Renteria is here, and she is the manager of that program. So if you would like more detail, perhaps she might be able to add that in.
No, that answers my question. I was kind of curious as to what it was, and
it's the occupational therapist coming in and making specific recommendations for that individual, and then they work to make sure that whatever is recommended is provided.
So typically this is a person who's already in the residence. This isn't like getting a residence ready before the person moves in.
Correct. It's someone who's usually there and needs some assistive devices and things that perhaps they're not even aware of when the occupational therapist comes in and can identify those items.
Excellent. Thank you.
Does Samantha need to add anything to that? Or do you have your
Joan explained it very well.
Okay.
That's basically we have the OT who comes in, she does her assessment, and then based on the assessment, then we reach out to our vendors to provide the devices or our contractors to modify the home and so forth.
Thank you. Thanks.
Sure.
Okay.
Can anyone hear me now?
Yes.
All right.
Yes.
This is more frustrating for me than it is for any of you, but they're doing major renovations on my building and they keep cutting out the cable and the Wi-Fi. So I'm sorry, I seem to have it now. But if I don't, Vice Chair will take over. Thanks. Okay. Are there any other questions or comments?
I still have a couple little things that go to on this, and in the staff report, they also have a section about monitoring and review. And I was curious to note whether there were 5 different items listed that were being monitored, also considering. I was wondering if that is also considered in a normal, everyday contract, or is this just because of the pandemic that causes that these 5 questions may have some weight to them? And I was wondering how they were weighed. If like, say, I go to all the board meetings that my organization might have, what kind of points does that give me? I'm a little concerned about this. So I was curious as to know what it is and why it's there. David.
So those points, as you refer to them, those that have not changed due to COVID, those are expectations of the contractors that they are fulfilling that contract by participating in each of those various aspects. So it didn't change for COVID. Still have those expectations, not weighted per se. But if there's something that, when we go in and when the staff goes in and does the review and noticed prior to the review that participation or whatever the issues is lacking, then it's addressed at that time. And that's what the program administrators are, that's part of their relationship with the agencies, is to work with them to be able to fulfill and meet all of those.
So it's just sort of a kind of a guide or a cookie cutter like way we go and approach them and say, oh, you aren't really reaching the goal of going to very many of our meetings. Is there a particular reason you're not going? That's how I'm reading this. It's not necessarily weighted, like say, I get 2 points for this and 3 points for that and 2 points for this. Because that's the way I read it. And then I had to come back and kind of argue with it.
It's not weighted. there are expectations that they will meet each of those goals. And then we do look, each year when the program administrators prepare to begin their site visits, their reviews, we look at something that has come up, during that year. And, if it's a challenge or, so many things came up during COVID, but we will add to that. How are they addressing challenges with service provision? So there are modifications to the review process.
And then, okay, I'm happy with that. I think I got an idea what it was I was looking at. And then above it, you said that the overall social services decreased by 9%. I looked everywhere in this report for that 9%. Just like how many number to number. So I think it would help some commissioners. It may only help me, I don't know, if you knew what you were thinking or comparing it to without having to look through volumes of stuff or call and say, hey, why are we down 9% when this looks like very full? It looks like there's increases in some places. So I'm having difficulty with the 9%. So I couldn't figure out where it came from, and there was no explanation for it. So it would be nice if you have something that's going to say we went up 8%. Say we went up from 8,000 clients to 8,008 or something like that. Just like an extra part, because the reader is kind of confused by that. It doesn't. There's no other place. It's not mentioned again. Period. Anywhere. And I can tell you, I read it. On the Jewish Family Services West Hollywood Comprehensive Center. I had trouble with their acronyms, and then they explain their acronym on the second page. So I'm not sure if that would help, but I stopped, when I can run into a problem, I stop reading and I start looking for something else and a way to find a way to what this means or why does this mean what this means. So their first paragraph or their last paragraph would have been better served in the first part of the report, letting me know that that's what they're talking about, number one. And then the ADL and the IADL, once I found out what they were, then I now have a problem with the incidental activities of daily living. And I'm not sure if someone can explain to me why we would use the word incidental. Shopping and cleaning and paying bills, things like that are not incidental. They're part of, they may be not as regular as eating and grooming. So I was thinking possibly a different word would work better, but incidental didn't work. It just, it made me think of something that I could not pay attention to. Like, oh, this is incidental, I can go to the next thing. So I'm not sure if I looked up the word in Roget's thesaurus to see if I could find a good complementary word to incidental. And I came up with occasional, which makes better sense, and it doesn't have the same connotations that the word incidental has. So I don't know if that's something someone wants to correct, or if it's something that's governmentally approved and they like the incidental, which just makes absolute no sense, then that's fine.
Marina Berkman is here, and if you would like, she should be
Marina
able to chime in. Marina?
Yes, absolutely. Do you hear me?
Yes, ma'am.
Okay. Good evening, everybody. Incidental ideals and ADLs, that's the accepted abbreviation established by the Department of Aging. So it's used by all senior services across California, and I can safely say that across the nation. That's just an abbreviation, and the incidental, yes, you're correct. That's something that people don't do every day. Why that word was used, honestly, that's also beyond me. I agree with you that occasional would probably sound better. It would be more understanding and understandable. So, but we can't change that. That's something that is being used in all documentation used by the Department of Aging.
All right. I think that answers it right away. I don't think I'm going to be able to change the Department of Aging from here.
Nope.
So we'll just let it go. Incidentally, we'll let incidental go then. I guess. Just that it didn't make a whole lot of sense. JBS SoCal Works, I'd like to make a personal note of their experience. They did really well. These numbers that they have here are good for them in a normal year. So I'm really pleased with them because as some people who know me have known that I've been as fairly critical or at least paying attention to that particular organization. So they get a thumbs up from me. And that's all the questions. I'm sure everybody will be glad. I'll turn it off.
Are you sure? Does anyone else have any questions or comments? Any other commissioners? Patrick? I'm sorry, Commissioner Shamrock.
Sure. I just want to thank staff and our service providers for this important and really inspiring presentation. So we've come a long way since last year at this time, and it seems like a lot of challenges were bravely and creatively overcome. And from the recent numbers, it seems like we're slowly getting back to more of a regular capacity. And I find it all very hopeful so thanks everyone for their work.
Anyone else? Vice Chair Meltzer.
Thank you. I just want to say what Commissioner Shandrick said. Bravo. And you have done an amazing job, all of you. And I am so proud to be a part of this group. And congratulations to everybody. You've worked so hard, done so much work. And I think you're just all fabulous. So thank you.
Anyone else? I have to, I myself want to mimic what they both said, but I want to point some out. LA LGBT Center Senior Services, 200% of their goal. 150 at the Mental Health Services LA LGBT Center. Pathways 175. Step Up 1 Second 187%. These are amazing numbers in a really, really bad time. So I think we're doing very well. I understand there's some challenges for some providers. I'm sure that they will be improving as they visit us and as they're helped by staff. But overall, this is truly, truly impressive. Anyone else? Okay. Again, I want to apologize, and if you're confused by what's happening, trust me, I'm more confused. We have new business 4A. Being Alive's syringe service program.
And we're going to turn that over to
Derek.
Yes, so we have Timothy and Jamie from Being Alive. I know that Timothy has a slide deck, so whenever you're ready, Timothy, to share that. And you are on mute too.
Thank you, Derek, and thank you, commissioners. All right. So let's start the slideshow. Okay, my name is Tim Zembek, and I am the Syringe Servicing Program Coordinator here at Being Alive. And this is a short presentation about our SSP. So what does our SSP offer to the residents of West Hollywood? We offer sterile needles and syringes. We offer safe disposal of used needles and broken glassware that's used for safer smoking, condoms and PrEP resources, overdose treatment and education, wound care kits, HIV testing and linkage to treatment, and referrals to STI testing and treatment, HCV testing and treatment, and medication for opioid use disorder. A basic safer injection supply kit comes with what you see here. Over on the, starting on the left, that blue strip is a tourniquet. The two little silver things are cookers. The sterile syringes, a little packet of cotton pellets, which is used as a filter to draw the drugs up into the syringe, sterile water, and alcohol prep pads, as well as educational materials on HIV and injecting drugs and how to clean your syringe, although nobody should actually have to clean a syringe because they can get clean ones from us. One thing that we currently do not offer in West Hollywood that we'd like to be able to do is offer safer smoking kits. And the reasoning behind this is, one, it was originally approved by CDPH and being offered as a COVID-19 measure. Secondly, it is a way for us to engage people that are not using needles. So being able to get information to them about HCV, STI, HCV, and treatment. It's also a way for if somebody, it's a safer way of administering drugs to themselves. Rather than poking a hole in their body with a syringe, they can use, they can smoke it. A wound care kit, it's basically a little first aid kit. There's Band-Aids, there's white petroleum jelly, there's lip balm, there's triple antibiotic ointment, gauze, tape, gloves. We've actually replaced those educational materials with a specific handout about skin conditions that somebody who injects drugs might be facing. And of course, there's our safer sex kit. There's 20 different condoms in 4 different types or flavors, if you like. Information about PrEP resources, that purple pamphlet there that says take action and save a life. I'll be showing you parts of the inside of that. That's about our overdose education and naloxone. Fentanyl test strips. We offer these to our clients because we have seen an increase in fentanyl. Pretty much now, anything that is a powdered drug, whether it's snorted, smoked, or injected, most likely has fentanyl in it. Even some of the pressed pills or capsules most likely has fentanyl in it. One of the issues with these fentanyl test strips is there are 23 known analogs of fentanyl. These only test for 11 of the 23. Also, they are unreliable when it comes to testing methamphetamine because there's something chemically about it that creates a lot of false positives. So they're not perfect. And we have anecdotal reporting that some people are using them. You know, they're supposed to be testing so that they can find if there's fentanyl in their drug supply so that they avoid using fentanyl. And some people are actually using them to find out if there's fentanyl in their drugs so they can use it because it has the fentanyl. Overdose education and Narcan distribution. We have a standing order through CDPH, which allows us to distribute this life-saving medication. It is an opioid antagonist, meaning that it will knock the opioid out of the receptor in the brain, therefore reducing or removing its ability to affect the central nervous system, specifically the breathing, which will allow a person to stay alive. We do trainings either with local CBOs We also have it available during the hours of our SSP so that we can do a 5-minute education, what to recognize with an overdose and how to use the medication. How to recognize an overdose. This is part of that purple brochure that we hand out. If somebody's not breathing or has gurgling sounds or snoring loudly, their skin feels cold or clammy, their lips and nails might be blue, and their pupils are going to be the opposite of what you would think. They're going to be really tiny instead of very large. So what do? We try to shake and shout the person to see if the person responds. If they don't respond, then we're going to give them the naloxone. It is available in both nasal and injectable. We only carry the nasal at this time. We don't need to know what exactly they may have taken, in the fact that naloxone only works on an opioid. So if they're on oxycodone, oxycontin, fentanyl, opium, or heroin, this will reverse the effects of that. If they've taken anything else that's causing them to be unresponsive, the naloxone, we can give it to them, but it's not going to do anything. It's not going to do any harm. It's not going to do any good. We check their airways. We do rescue breathing for them if possible, put them in the recovery position, call 911, and we don't leave them until EMS arrives. We are currently in West Hollywood behind the AHF pharmacy at 8212 Santa Monica Boulevard. We have up through this month, we have been there twice a month. Starting January 8th of 2022, we will be there every Saturday from 4 to 7 p.m. We take needles for IV drugs, steroids, hormones, insulin, other prescription drugs. If your pet's got diabetes and you have needles from that, we can take those as well. I am pleased to report that we have actually taken in more used needles than we have given out over the last year. And we also have our location at our offices in Hollywood. We are there Tuesdays and Fridays from 9 a.m. to 1 p.m. And that concludes my presentation.
Thank you.
Were there any questions?
Thank you very much. If any of the commissioners have any questions? Stephen, do you have your hand up? Stephen?
Yes, I'm sorry. You asked me to do two things at once. The presentation was very good. I saw the presentation at the earlier last month, the recovery and addiction services providers, I guess, meeting. And I really liked the kits. I thought they looked really like they were full on and could take care of everything. My concern is, and I wrote it on every one of them, was how much do they cost?
We actually we get all of our supplies for all of that stuff from through an allocation from CDPH.
Okay.
So our budget for this year for needles and all of the accoutrement to make all the kits and everything is $16,000, and that's covering what we need for both the Hollywood and the West Hollywood location.
So if I were to get one of those, you would give it to me free. So
all of this, yes, everything that we give out is free, including the Narcan.
Okay, cool. Good work. Thank you very much.
We've even given some Narcan to the fire department when they stopped by and told us they were out, and we supplied them with a couple of cases to get them through.
Excellent. Excellent. That's what you call, what is that? Community-based organization.
Yeah.
Any other questions, Stephen?
No.
Okay, thank you. Any other commissioners? Vice Chair Meltzer?
This is terrific. I would just like to know how you let people know where you are, what you have, and how they can get it.
We have been taking several different approaches. We have just provided the outreach teams with the City of West Hollywood with a palm card that has what the services are that we provide, and then our times and locations on the backside. We are actually going to be posting a sign on the back of the Out of the Closet. So for the unhoused people, that they can, when they're congregating there after the building is closed, that they can say, oh yeah, we can come by and get stuff. We have run an ad on Grindr. So that we did have a great click-through rate with that. Unfortunately, it didn't translate into anybody showing up. And we did present last month, as Stephen said, to the HIV providers and substance prevention providers for West Hollywood, and several of them have reached out for us to provide a training and or presentation to their staffs.
Great. Thank you. Great.
You're welcome.
Can I also, sorry, can I add one thing to that too? Fortunately for us, we have, this syringe services program. It's unfortunate for the county because I think, Jamie, correct me if I'm wrong, there's only about 7 or 8 for the 10 million residents of Los Angeles County.
9 actually.
There's 9, yeah, which is crazy. But word of mouth is going to be the thing for this program, as well as agencies pushing it out. I think the program's already been successful so far, but now since it's going to be once a week, I think we will expect more people to utilize it.
Thank you. Commissioner Freiberg, did you have your hand up?
I did. I was at CVS Pharmacy on Santa Monica and La Cienega, and there were 4 guys in front of me looking for fentanyl test strips. And the pharmacists, there's probably about 3 or 4 of them, had no idea what they were talking about. They thought they were asking them for fentanyl, and they had no idea where they can get the test strips. So they left with nothing, and they didn't know where to go. So I was wondering if maybe you, Timothy, where did you go? Oh, there you are. Hey, if you ever teamed up with CVS or can team up with CVS so people know where to go, or,
One of the things that I haven't done it in West Hollywood. I did do it in Hollywood. I hit all of the CVS, Rite Aids, and Walgreens. So that is something that I can definitely do in West Hollywood. Another thing that, again, we were impacted with COVID, as you all know. And one of the things is we've been slow to take on volunteers. And one of the things I want to be able to do is start doing good old street outreach, going into the encampments and the places where the unhoused congregate, and those the shooting galleries that I'm aware of, and letting them know we're here for them.
Anyone else?
I think Chelsea has her hand up.
Commissioner Byers, do you have your hand up?
I do. Thank
Okay.
you so much. Thank you for the presentation. I'm always moved when I hear that these services are provided, because I see them also just as points of entry to larger relationships with the service provider network in the city, and just really grateful for all the creative ways that you're getting the word out. I did have a question about whether or not our block by block security ambassadors are trained on Naloxone or Narcan administration. If anyone knows
We
that.
did when we did talk to them, and they were aware of what we were doing when we were based in West Hollywood. I can reach out to them again and get them trained. One of the other things that I really would like to do is for the nighttime security at the different bars, is reach out to them and let them know, and do a training with them as well. Dean has reached out to me to have to do a training for the secretaries at the West Hollywood Recovery Center, as well as community members. So we've got different things. A lot of it's going to happen, in January because, well, we're in the slide to the holidays now.
Thank you.
And I can follow up with our public safety department about block by block. I know that emergency personnel are all trained in Narcan, but I'm not sure about block by block. So we can get that information for you.
Yeah, I'd love to know that. Thank you so much. I appreciate that.
Thank you, Commissioner Byers. Commissioner Shamrock?
A very interesting report. Thanks, Being Alive, for being here. I just wanted to clarify something, Timothy, you said about how the test strips can be unreliable in detecting fentanyl, especially in methamphetamines. I just wanted to maybe hear more thoughts about that. I am assuming most people using the test strips in West Hollywood are testing methamphetamine, so there's just some concern.
Yeah, there's some concern. Well, there's concern with the harm reductionists around the country about this as well, because there are, if you Google information on how to use one of the test strips, there's conflicting information out there. These test strips were originally designed to test fentanyl in urine. They've gotten, the harm reduction community has gotten creative and adapting them to test powdered drugs beforehand, before they're used. So, and where some of the conflicting information is coming up is how much water to how much product should be used to test. And, even if, when I give them out, I have this conversation with people saying, they're not foolproof. Be careful and follow the basics of harm reduction, and that being, don't use alone. If you haven't used in a while because you've been incarcerated or you just got out of treatment or you're relapsing or whatever it is, use slowly. If you're using from a new supplier, use with somebody else, and one of you use one at a time. Because we want to keep people alive and want to keep so that they can make the decision to go to treatment. As somebody else said earlier, that a lot of times people come to the needle exchanges, they're already pre-contemplating making a change in how they're using their substances. And we just happen to be the people that are there to help them.
Yeah. Thank you. Thank you for sharing. And I wondered if you could tell us a little bit more about, I understand harm reduction around needle exchange to prevent transmission of disease. If you can talk about safer smoking versus unsafe smoking.
Okay. So it's called safer smoking supplies, just like when we give out condoms, it's safer sex supplies. Because everything, smoking does have risks attached to it. You're taking the smoke into your lungs and stuff like that. It's considered safer because you're not injecting. So therefore you're not poking a hole in your body, exposing yourself to syphilis or HIV or hepatitis, all bloodborne diseases. So you're reducing that risk. The bigger thing with being able to offer the safer smoking supplies is that we are going to have that opportunity to engage with people. When I started offering them at my location in Hollywood, I would now say that about 80% of the people I see are coming for safer smoking supplies, crack pipes and meth pipes. And so I'm able to have those conversations with them about, hey, did you know that there's fentanyl in pretty much every powdered drug that's out there? Here are some things you can do to protect yourself. We have statewide and countywide calls with other people that are specifically doing SSP work. And so we share information with each other. And when I hear about something that's happening in downtown, it's 2 to 3 weeks later that I hear about it happening in West Hollywood and Hollywood. So we've got our fingers on the pulse of what's going on. We're hearing what's happening, and we're sharing that information from our participants to our other participants. One thing that I think I'm going to start doing that I would just heard about today on a call is doing a little whiteboard that says, hey, last month we gave out X number of doses of Narcan, and of those doses, we saved X number of lives. Because that's important stuff to know. I personally have administered 3 doses of Narcan, or I have saved 3 lives from administering Narcan. I live in downtown, so one was on the street, 2 were in the subway. I carry it with me all the time because I never know when I'm going to have to use it. Does that answer your question?
Yes, thanks for being here, Timothy.
You're welcome.
Else? Any other commissioners? All right, I'd like to ask a couple of questions, but first I'd like to thank you for your generosity with not only information, but with your kits and your ideas as far as harm reduction. For me, harm reduction is the answer to a lot of the problems, but it's not always seen that way. And some of the kits are a little bit shocking to see the first time, and that's okay. Safer sex kits were shocking to people too. They thought we were just, everyone have sex. As I see this progress, I look forward to the future of it. That's what I can say. You said that, because I'm a little bit confused here. You said that it's an opioid antagonist, but if it's mixed with meth, it will work, correct?
Yes, it'll work. It's the fentanyl test strip
Yeah.
that we have the problem with giving us an accurate read.
Yeah.
But if you're using the Narcan, anything that's an opioid will automatically work with, yes.
Great, that's good to know. And I would like to ask Jamie a question that he brought something up with me during a conversation, and you had said that you believe folks are actually seeking out fentanyl. Did I hear that correctly?
You did, and that's part of the reason Tim brought up that some people are actually using the test strips to make sure there's fentanyl in their product because they want that extra kick. Not that I understand that, because it's so dangerous, and it's just getting more and more dangerous as it gets more intense. And the carfentanil, that's the newer version, that's so much more toxic and dangerous, is in the area.
It's pretty scary. I do want to thank both of you and your team for your work. It's astounding to me. Is there anyone else that would like to say anything while they're here? Okay, thank you so much. 4B, Nutrition Services Presentation Report. I believe this is going to Joan first.
Yes. As mentioned earlier, the pandemic really highlighted the importance of providing meals to vulnerable community members. So tonight we have staff from the 2 city contracted meal programs who are going to give brief overviews of their services, share information about how menus are developed for their respective programs, and answer commissioner questions. Siri Perlman, Director of Senior Nutrition Services at JFS, will begin, and she will be followed by Robert Bowler, Director of Programs for Project Angel Food.
Good evening. Thank you so much for having me here tonight. I've enjoyed hearing the presentations and being part of such an amazing, just diversity of programs providing services to the residents of West Hollywood. So I'm very happy to be here, and thank you. Let me bring up my presentation. Can everyone see it okay? Okay. So yes, so I am the Director of Senior Nutrition here at Jewish Family Service of Los Angeles. And I will tell you as I present this that I started during the pandemic. I've been here for about a year now. So I'm going to present information about our program and the services that we provide both pre-pandemic. So you have an overview of kind of what it is that we would do ordinarily and then how we've pivoted as well. So we provide two different kinds of meal services for the community. One first being Congregate Meals. So pre-pandemic times, and hopefully not too far from now, we will be able to return to our Congregate Meal sites, but these Congregate Meals offer meals to mobile adults at the meal sites, such as senior centers or parks. And this is often the only social outlet for those in attendance, where they can form valuable relationships and receive a nourishing meal that meets the USDA dietary guidelines. We also have another method of service for clients, our home delivered meals, which are specifically designed for homebound individuals. They not only deliver a nutritious meal on a daily basis, but it's also a means by which we can check up on clients who are home and don't really have a lot of other interactions. Our drivers really get to know these clients, seeing them on a daily basis and knowing if there's, a change in their health status or they might need more help. And when we are able to return to in-home visits, we'd be able to do inspections too. So it's really allowing the clients to stay at home, stay nourished, but make sure that they're doing okay. And so our meals are based on the dietary guidelines for Americans. And, those guidelines vary from life stage to life stage. So specifically for older adults, we know that our meals it's very important for them to be fiber rich and also to be fortified with different vitamins and minerals that they may not be getting ordinarily in their diet, on their own. So this is the meal pattern that is required by the county that we follow. I'll be showing you a slide specifically with a week of our menu that we make in our kosher kitchen. But overall, these are the guidelines that we need to meet. So we need to meet 3 ounces of a meat or meat alternate per meal, or 2 ounces of meat or meat alternate if it's in a casserole. We need to have 2 to 3 servings per meal of vegetables and fruit needs to be served daily. We have 1 to 2 servings of grains or bread. This could be something like rice, whole grain bread, pasta, but we also utilize kasha, quinoa, and barley. We make sure that all meals averaged over the week meet at least 7 grams of fiber. Each meal contains 1 cup serving of milk. Because we're a non-dairy kosher kitchen, this is in a dry milk form, but we do provide the milk. Fats are optional. There's no requirement for fats, but our meals are free of trans fats. And we do include 1 serving of dessert per meal, but over the week, this is mainly fruit, but once a week we can have a non-fruit option, and we do bake some cakes in our kitchen, so they'll get a serving of cake once a week. And then when we do have our congregate sites open, we do have water available. And I believe that we'll also have coffee and tea. Again, I have not had the privilege of being in a congregate meal site yet because we've been closed. So these are some of the options that we would have when we have our in-person dining. Here's an overview of the vitamin and mineral requirements that we have as part of our menus as well. So vitamin C, we need to make sure that we have 25 milligrams every day. Examples on our menu are orange juice and bell peppers. Vitamin A needs to be provided as well. Some examples would be carrots and cantaloupe. Vitamin D needs to be averaged throughout the week, and our milk is vitamin A and D fortified. Fiber needs to be included with at least 4 high fiber sources per week. And examples would be whole grain bread, brown rice, or lentils. And sodium needs to be less than 1,000 milligrams, but within a target of 500 to 750 milligrams. And all of our sauces, our gravies, and our soups are low sodium. And then potassium must be served consistently throughout the menu. And some of the examples that we have are mashed potatoes, bananas, and squash. We always have roasted squash, and it smells delicious and tastes delicious. So we have a 6-week cycle menu, and I'm displaying the first week of our menu. So you can see here, these are the weeks throughout the program year that this week 1 will be served to our clients. You can also see that we have the requirements for all the different food groups listed here, so that we make sure that we're meeting all of the requirements. One of my favorites on the menu is the beef bourguignon. I was so impressed to see the variety of foods we have. You can see grilled fish with a mango sauce, chicken stroganoff, beef hamburger or a black bean patty or baked chicken. And then when we do for our 7 meal packs, vegetable souffle and beef tips with mushrooms. You'll also notice that if we go down along this line for all of the requirements, orange juice has 1 asterisk, which means that it's counted towards the vitamin C requirement. Our whole grain bread that has 3 grams of fiber per slice. Garlic mashed potatoes has this equal sign. You'll see the key at the bottom that it's designating as high in potassium, meaning that we're meeting that potassium requirement. Our vegetable requirements, seasoned yellow squash and peas. And then you'll see our dessert for this particular day is fresh canned peaches. You know, during the summer, we will utilize fresh fruit, but when we get to winter months, you know, canned peaches are more readily available, but with no added sugar. Our milk requirement, as I mentioned, is satisfied by dry milk because we are a non-dairy kosher kitchen. And then when we are at the Congregate Meals sites, we do serve water. And then you'll also see an example of banana squash with a 2 asterisks, meeting our vitamin A requirements. So it's very specific in meeting the requirements, making sure that every participant gets a very well-balanced diet. We also proudly honor holidays for our clients. So there's a second page as well. So we just celebrated Thanksgiving, and our clients were able to enjoy turkey with gravy, bread stuffing, pineapple, yams, and some pumpkin pie we made in the kitchen. And we're about to send out our Christmas menu. So sliced turkey with gravy, cornbread dressing, sweet potatoes, and apple pie. Again, meeting the requirements, and also, you know, these are a few times a year, so not a lot of pie going out, but it's a nice way when congregate sites are open for our seniors to celebrate with one another and decorate and enjoy the holiday when they might not have company otherwise. And then for our homebound participants, for them to be able to enjoy a holiday and have, you know, get that caring through a meal where they don't feel so alone on the holiday. And this is an example of our Thanksgiving meal that just went out a few weeks ago. So and also our meals during the pandemic are frozen. So I took the components out of the frozen meal container with the turkey and stuffing and sweet potatoes and beans and put them in the microwave, heated them. But they do get a fresh salad with freshly made dressing, and this pumpkin pie was made from scratch in our kitchen. A fun fact, I do not eat kosher. I'm learning a lot about kosher food, but the crust on the pumpkin pie was not made with graham crackers because graham crackers often have dairy. So fun fact, I don't know if any of you might guess, maybe later you can tell me if you figured it out, what the crust is made of. They used cornflakes, and I wouldn't have known otherwise. It was quite delicious. So this is our chef Hugo, who's amazing and who's been here for over 30 years. And this is Armando, one of our team leaders as well. And these are the sheet pans where they made over 600 servings of all of this. So eligibility, you might wonder how clients qualify to be part of these services or benefit from these services. So in West Hollywood, which is really wonderful, you've actually lowered the age limit a little bit. Countywide, LA Countywide, it's any person 60 or over, but here in West Hollywood, it's any person 55 or over for congregate meals. A spouse can also attend a congregate meal site. A spouse of someone 55 or older can accompany the older individual to a meal site and have a meal, and also a person with a disability under age 55 who's able to travel to a congregate meal site can participate in the congregate meals. Home delivered meals, any person 55 or over who's frail and homebound by reason of illness or disability. Also, the spouse of this person described can also get the meals if it's in the best interest of the frail or homebound person. And then a disabled individual 59 years or younger, if need be, if they're at home, they can also receive home delivered meals. So an idea, a picture of, this is from November data, but we were serving 100 clients through our Congregate Meal program, which amounts to about 600 meals per week that we're sending out. You can see West Knoll, we have 18 clients, North Palm Apartments, 30 clients, 3 of which being non-senior. Plummer Park, we're serving about 28 clients, and Fairfax Towers, 24 clients. In our home delivered meal program, we serve 113 clients, which is about 800 meals a week. So that's about 1,400 meals per week that are being served to West Hollywood seniors and some non-seniors. And here's a picture of our grab and go that we took last week. Just very simple. And I want to thank, our partners with the Social Services Division who helped us arrange this so that we could quickly pivot when MV Transit was no longer able to assist us, and be here in the park once a week on Tuesdays for seniors to pick up meals. And you can see she's come with her own refrigerated bag, her 7 frozen meals, and then her sides, her components. You can see some baby carrots, some juice. And so it's a nice way to just visit with them, chat a little bit, and make sure they get their meals for the week. And here's some other pictures of just the seniors that come and visit us in Plummer Park. And we just really enjoy getting to see their faces. For a long time, we weren't getting to see them, only the drivers who were dropping off the food. And so, as was mentioned, in a very holistic view of all of the programs that you provide to West Hollywood residents, we are one of the programs, obviously, that serves the older residents. And I can say that one of the questions was regarding, was there a difference between 80 and 90-year-olds in the section? There are some areas, I believe it's West Knoll, that we have a bunch of 90-year-olds in that building. And so we want to make sure that we can continue to deliver meals to them until we can open the meal site in their building. But you can see the distribution of age definitely skews to 70 or older. And, this was a time of, as was mentioned, a lot of adaptability, a lot of pivoting, and we had our original goals set for what we were hoping was going to be more of a normal year, but we far exceeded them because of the need, and also because of the fact that when we do have congregate meal sites open, not every senior comes all 5 days. They often, from what I have heard, because I have not been here when the sites are open, they might come 2 or 3 days, but because of the nature of people staying at home and delivering the meals, we deliver a set of meals for the week. And that's why the congregate numbers are so much higher. So overall for the congregate meal program for this fiscal year that we just completed, or program year, we were 175% above the goal, which meant a lot more production as well and a lot more deliveries. And then home delivered meals, you'll see that we actually were a little bit below goal. And part of the reason for this is because, people who are homebound and have a lot of medical conditions or are frail, they may end up going to live with their family. They may go into the hospital. They may end up in some sort of assisted living. And so those people will leave the program. And then usually there's a natural transition from congregate to home delivered when congregate is at a site. But because it's been a little bit more hands off this year and a lot of people still receive meals delivered to their home, there hasn't been that natural transition from congregate to home delivered. So that's part of the reason why it's 90% of goal. And then supplemental nutrition, we were at just about 100% of goal. And these are meals with some identified home delivered meal individuals who need some additional nutrition. And we provide 20 extra meals, shelf-stable meals to them, snacks, so that they can increase their caloric intake and get the nutrients they need. And then just an overall view, it has been mentioned in some of the updates, but pre-pandemic, we had 4 congregate dining sites open Monday through Friday, and home delivered meals were similar to what we're doing now for most participants, 7 frozen meals delivered on a weekly basis. So when we did need to close the meal sites due to COVID-19 in March 2020, we started delivering 7 frozen meals per week to all participants, congregate or home delivery. And we're very, very grateful for all of the help that MV Transportation provided to us during this time. And as Katie mentioned, and Katie's been a wonderful partner through all of this, so thank you so much. We needed to pivot again with MV Transit going back to their regular services. And that's when we opened up a grab and go at Plummer Park in July. And then we continued the meal delivery service to West Knoll, Fairfax Towers, and Palm. And the home delivery model has continued this entire time. And we look forward to being able to reopen meal sites, but as we all know, things are constantly changing. We are all watching county guidance to see when we might be able to do that. And so we just remain flexible and adaptable, just trying to meet the needs of all of our clients with uninterrupted service, regardless of the model. And I just wanted to take an opportunity to also show you some of the faces behind the scenes that are making this happen throughout this entire time. These are our everyday heroes, from the people who are in the kitchen, making the meals, getting the food in and out of the kitchen, our drivers who are delivering the food and caring for our clients and making sure that they're okay. And they might be the only smiling face they see once a week at their door, to providing the meals at the grab and go and packing all the food. So I just wanted to give you an opportunity to see some of the people that have really been keeping this going with those 1,400 meals per week that have been going out. And that concludes my presentation, and I'm happy to answer any questions you may have.
Thank you very, very much. Do any of the commissioners have any questions for Siri? Great. I would just like to say that I think this is pretty amazing. I've actually had a few friends that are using the service, and the people that delivered are extraordinarily friendly to them. And everything you said is included with that, because we didn't know what the white powder was that came with it. And they called me. I said, I'm believing that that's non-fat milk. But yeah, so thank you so much. Really, really impressive.
Thank you so much.
And next, David, next we have Project Angel Food. Okay, Robert Bowler.
Yes, hello everyone. Yes, Robert Bowler. I'm the Director of Program at Project Angel Food. And it's always good to speak to the commissioners as well as the staff and public from West Hollywood. And I'm here to talk about our services and what services we offer and what our meal standards are. And thank you, Siri, for an excellent presentation. I did provide some materials for the packets, but I don't have anything to share with the public, so I apologize for that. But if you want to find out more about our program, you can Google Project Angel Food or go to our website, angelfood.org. And one of the documents I shared with the commissioners is a colorful brochure. It's our trifold brochure. It just is kind of an outreach product we use that we haven't had a lot of outreach lately as far as going out into the public because of the pandemic, but it is has a lot of the information about our services we offer and directs you to our website. And the website is where you would download material. So we are a program for the critically ill. So in order to become a client, you must take our application form to your doctors, and the doctor certifies your critical illness, and then we will process your application and get you on service. What we would offer our clients is basically, I always say we have one program, which is our home delivered meal program. And once you get into that, once you get accepted in that program, then you are offered several of our services. For example, we can provide most clients get 1 meal a day delivered weekly, so 7 meals, as well as a bag of fruit. And then, but you can be offered up to 3 meals a day, depending on your needs, so the individual needs. And we can also deliver extra food for children in the home. So that's kind of our basic home delivered service. But we also have available registered dietitians for counseling. So once you become a client and you will speak to the registered dietitian who will work on your medically tailored meals and decide what your diet will be, but also counsel you on better ways to deal with your critical illness. And so that's another one of our services. And we have registered dietitians in English and Spanish, but we also contract with a language company that offers translation over the phone. So we haven't found a language yet that they haven't offered us. So we try to reduce barriers and try to make it easier for people to get on service. We also began a program kind of in a pilot form just before the pandemic. And then when the pandemic hit, it really went off. We decided we have to do this. And it was patterned off of the program that the Motion Picture Television Fund has, and that's we call it the Telephone Angels program. So of course, with the pandemic, people were isolated or people were at home, and so it was very important for us to get that program off the ground, and it's been very successful. We match up volunteers with our clients who are feeling lonely, and often the volunteers are feeling lonely as well. So it's been a good connection, and it helps people with their well-being. And the other project, the other service that we have is kind of our gifts. We have birthday bags for our clients every year. We put together with donated items. The community is very great about donating these things. We also do toys for the kids at Christmas. So right now we're packaging the toys up for all the children in the home. We have 300 children who are in our clients' homes. So it's a big deal. People have been very generous this year, so we're doing well with that. Also in your packet was included a little bit of the science behind Project Angel Food. So we talk about food as medicine. We talk about medically tailored meals. So this document that you have, you'll see it kind of outlines our major diet categories. And for those of you who don't have the document, so we have a heart healthy, which is kind of our regular meal. It's heart healthy and diabetic friendly. It's also been approved by the Department of Aging. So it meets many of their standards. And then there's a GI friendly meal, a kidney friendly, which is for renal, for people with end stage renal. And it's interesting, we had a lot of clients coming to us with CKD. So chronic kidney disease kind of goes through a progression. And when you get to the end stage, that's when you have kidney failure and you're usually on dialysis. Those clients, we offered the renal diet for many, many years, but we recently developed the chronic kidney disease because many people that were on that continuum, the renal meal was actually doing more damage. So it was like you need a kind of a little more restrictive meal, that one that can actually help you stave off that progression of the disease, so you don't have to go to a lifetime of dialysis. So the chronic CKD, the chronic kidney disease diet, and then of course vegetarian. And if you on that, each of those meal categories have controls as far as the calories, carbohydrates, protein, total fat, saturated fat, and sodium, and things like that, and dietary fiber. And then also you'll see on that chart to the right is kind of the conditions or diseases that those meals would treat. And of course, there's a little bit of other tailoring that we can do as far as your fruit, or a soft or hard fruit, or and then the breakfast bag and adding more calories. But those are the major kind of categories. And what they're based on is we actually the 5 categories are based on the standards of the National Food as Medicine Coalition, which we are part of. And these are based on evidence-based guidelines such as the Dietary Guidelines for America, Therapeutic Lifestyle Changes, American Diabetes Association Standards of Medical Care, the National Kidney Foundation, Kidney Disease Quality Initiative, the Academy of Nutrition and Dietetics Nutrition Care Manual, as well as the Evidence Analysis Library. So these are kind of the resources the Food as Medicine Coalition has used to develop these standards. And then because we follow these standards, we've been able to, of course, help our clients manage their serious illness and have better health outcomes. But it's also allowed us to promote our meals and our services with medical providers and healthcare plans. And we were preaching food as medicine and medically tailored meals for many, many years. And everyone would say, that's great, but we don't really have money for that. Well, things are changing. And it kind of started about 3 years ago. We partnered with the state of California on our pilot for persons with congestive heart failure. So that's, their heart failure, and they have water retention, a lot of hospitalization. These folks, a lot of it because of bad diet. So we developed our Heart Healthy Meal, and we began a partnership with the state of California so that persons with congestive heart failure could come into our program for a 12-week period, and as well as having medical nutrition therapy. And this has been very successful. We're about to the end. We've had 375 clients in this program. And so now the state is kind of gathering up the evidence and analyzing it for cost savings. So this is really exciting. We can show that medically tailored meals in conjunction with your healthcare provider and your doctor, we can actually improve health outcomes and reduce costs. So we're so excited about what's coming down the pike. But this also opened up the floodgates. Since then, we partnered with LA Care here in LA County, as well as Anthem Health Plans, to serve some of their members. And they often send us high utilizers, people who were expensive. So they're again looking for cost savings. But they also sent other high-risk groups. For example, Anthem sent us several pregnant women with gestational diabetes, which is interesting. And apparently we've helped in that situation as well. We've also just embarked on a study, the Native American diabetes study with USC and some other partners in the American Indian clinics. And this is an IRB approved study. It's not just providing meals, but also counseling and peer partnership to help overcome a lifetime of poor diet and bad choices, and to change behavior and improve medical outcomes. So we're excited about that one. It's just starting out. And we've also just begun another program with Haluna Health in the San Gabriel Valley. We're partnering with many hospitals through Haluna Health. And the ideal is if the hospitals will identify someone with food insecurity, and they will be either given referred to Project Angel Food for home delivered meals, or they will be given groceries from Seeds of Hope, another agency that West High would fund. So these are kind of things that developing these medically tailored meals and following the standards has kind of opened the door and allowed us to partner with healthcare plans to actually become a part of people's health treatments. So we're very excited about the future. And just lastly, I'll just mention that the state of California, partially because of our pilot with congestive heart failure, but also because of a waiver that they've been working on, have approved what they call in lieu of services. And now the new program name is community supports. So they not only are going to use Medi-Cal money to pay for medically tailored meals, but also things like transportation and mental health. And there's several other categories of these kind of in lieu of services. So it's kind of like, instead of just spending on doctors and medicine, they're actually able to divert money towards preventative, towards things that will lower costs by investing in meals and transportation and things like that. So we're excited to be a part of that. We have contracts now with 3 of the health plans, and we're working on the others here in LA County. So I would welcome some questions, but I did just want to kind of fill you in on what's going on at Project Angel Food.
Thank you so much, Robert. Any commissioners have any questions for Robert? Any comments? Commissioner Freiberg?
Hello, thank you, Robert and Siri, for your presentation. Robert, I am so impressed with Project Angel Food, and just the fact that you said food is medicine is so important. And I don't know why people downplay it, but this was one of the reasons why I wanted these presentations to be, or a report back to the board. I mean, I'm sorry, the commission, about all of this, because food is medicine and you can harm our residents with certain foods that they put into their bodies, and we want them to be healthy. So I will go into why I wanted this report. So in 2019, JFS gave a meal delivery presentation to the Disability Advisory Board, which I was on, and I had serious concerns about the food on the menu. And many of the meals that were served were linked to heart disease and various cancers that can lead to an early death, especially for people with illnesses. I asked what guidelines they used, and they told me the USDA pyramid, which is very well known to be heavily influenced by lobbyists, especially meat and dairy industry. I was so concerned that I actually spoke in front of this commission before I was on it as a resident. And I asked them to ask our contracted partners to use a healthy alternative, which at the time, Robert, you might know this healthy alternative, the Harvard's Healthy Eating Plate. And it's created by scientists. And they actually came out with this plate because they saw how unhealthy the USDA plate was and how it was heavily influenced by lobbyists. And also the food was not sustainable. So now it's almost 2022 and I saw the menus for JFS. And here's a couple things, a couple examples of the food that they serve. Beef patty, beef stew, roast beef and gravy, beef chunks, brisket, beef meat pie, beef tips, beef Asian stir fry, Salisbury steak, meatballs. And for holidays, you get a hamburger sandwich, a beef hot dog sandwich. And you also serve milk and dairy, which is now known to increase the risk of prostate and ovarian cancer. Now, this is not my opinion. I'm not a nutritionist. I'm not a scientist, obviously. This is an overwhelming consensus from Harvard Public School of Health, Johns Hopkins, and the American Heart Association. They all agree that these foods are linked to heart disease and various cancers. Harvard even says even a small amount can damage your heart, lead to an early death. World Health Organization actually placed red meat, processed meat in the same category as smoking. And now Johns Hopkins is starting to see a link between meat and mental health issues. So on top of that, you still have these foods that are major contributors to greenhouse gases and the destruction of our natural resources. So knowing this, I find it very difficult to allow our residents to consume dangerous foods, especially residents suffering from illnesses. We don't want to inflict harm. We want our residents to be healthy and happy. We wouldn't place them in dangerous housing, so we shouldn't feed them dangerous food. So if the city commission is committed to keeping our residents healthy, committed to climate action plan to reduce greenhouse gases, conserve water, and if we're committed to animal welfare and giving our residents the highest quality service, we should require at least contracted partners use the Harvard's Healthy Plate, which I might change my mind, Robert, because you have a lot of information, and to replace the red meat and processed meat with healthy alternatives. And that's all I have to say. But once again, Robert, I didn't know about food as medicine. Some of the things that you talked about. I mean, you had a lot of resources that you were talking about, and it would really be great if we could expand on that. And I'd rather, spend money making our residents healthy and not harming them. I mean, our job is to make them healthy or to help them with their health, and we want them to be happy. And
agreed 100%.
Yeah.
And we never stop. We never think that we have the perfect product. We always are looking for the new information to make our product better. And actually the folks from the Harvard are on the food, a part of the Food is Medicine Coalition. So
Okay.
they've had an influence on our group as well. But I'm sure we could learn more, and I appreciate your bringing that up, because I will discuss that with our registered dietitians next time we're there.
Yes, definitely. And any more information you want to give to us about, what your new things that you're looking at that can help our residents and their health, please
Absolutely.
pass it along. Thank you.
Will do.
Thank you, Commissioner Freiberg. David, you have your hand up.
So I think we ought to allow our guests to respond to some of the concerns that Commissioner Freiberg mentioned, and if not tonight, then to provide a written response. I heard a different report than what Commissioner Freiberg just mentioned, especially with regard to dairy, milk, and then frankly, all of the meat products that were mentioned. So I want to be sure that our guests have an opportunity to respond, and then also to provide follow-up information.
Okay, well, the two resources that I used in case you want to research this was Harvard School of Public Health and Johns Hopkins School of Health. So those are the two where I got that information from.
Right, but I'm referencing the presentation tonight and the menus presented tonight. So Siri, it's up to you if you would like to respond, and it's not to put you on the spot, but I felt like since we had some pretty direct feedback on the presentation, either tonight or if you'd like to provide a written response later, we can present it at the next commission meeting.
Yeah, thank you. Well, I'll tell you that we feel and I feel that it's our privilege to provide nutrition to our clients. I think of this, as prevention as well, because most of the people that we serve don't necessarily have access to a lot of food or the variety of food for them to have a healthy, well-balanced diet to get the vitamins, minerals, protein, everything that they need. I'm a registered dietitian. I believe in healthy, fresh, well-sourced food as well. I appreciate the passion and the commitment to nourishing the residents of West Hollywood and all of the clients that we serve. I think that there's a lot of different models out there, the Mediterranean diet, the Harvard Health Study, all of these things. And I think they're all wonderful in their own way. I will say that we do follow the guidelines that are required by the city and the county. I can look into whether or not we can try to have a few more plant-based options on our menu. But I will say that I am very proud of the service that we provide and the variety of foods that we provide. But I do understand some of the concerns that are coming up regarding red meat and some of the things that we source. But I think too that we serve a community of individuals where we want to provide them food that they will eat as well, that are familiar to them. And so I think that the goal overall from everyone who's spoken today is a well-balanced, nutritious diet. So how we go about getting there and working together to do that, I look forward to it. But I guess I want to end this by saying that we feel very privileged to make sure that these seniors are being nourished at this point. But again, I look forward to continuing the conversation. So thank you. And I think Robert's presentation was amazing. And I love the resources and the prevention that he provides too. So thank you. And I'm happy to also email or talk with anyone later at another point individually too.
David, did you have another remark?
No, that was it. Just want to make sure that Siri had an opportunity to respond.
Any other questions or comments?
I just have one more question. Because Siri, you said that you were required by the city and by the county to use the USDA MyPlate, and Robert, you're not required to use it?
For our heart healthy regular meal, we do have to, the City Department of Aging also approve that menu. And I know they have some requirements of things that are a little strict.
David, do you have the requirements available to you?
It's not our requirement.
It's not your requirement.
Not the city's. But no, and this is to generalize, and these are really good discussions to have as we go into the funding process, because know that almost 100% of our contracted agencies are receiving funding from either county, state, federal. So they are following those guidelines and those requirements. So, but no, the USDA requirement is not a city.
Thank you.
Anyone else? Any other commissioner? I'd like to thank Robert from Project Angel Food for a great presentation, and Siri as well. And I'd like to thank you for your follow-up response. And if you have anything that you want to send to staff that might continue this conversation, that's great too. Thanks so much. Okay, David, now we get to do the fun thing.
So this is, it's been a little bit of a long evening, but we wanted to bring the 2021 work plan just for your review and reference as to what was presented to the commission, what was accomplished by the commission this past year, and then a draft of the 2022 work plan. And just, I'm going to be very brief. I just wanted to get it in front of you and then talk about, a little bit what's different in the third year, or the third year of the contract and going into the funding process. So I'm going to once again share my screen if I can, Jenny. Let's see. So this was the 2021 work plan that you just completed. And, for this commission, a lot of the work is kind of prescribed into what comes under your purview and your responsibility, as you know. So the first 2 years of the contract period, you receive a lot of reports from the contracted agencies, as you did this evening. You get that kind of what we call the annualized report. So you always get the mid-year report on social services, you get the year end, as you also did this evening. So a lot of it is kind of prescribed and in place. But with that said, we want to make sure that you still feel like if there are issues of interest that you would like for staff to do some research and present to you, that there's those opportunities as well. So I won't go through this item by item, but I think it is both a testament to your dedication and hard work, and then to frankly the staff and our contracted agencies that you had packed agendas and really did a lot of work and received a lot of information this year. So that was your 2021, and then this is just a draft that I wanted to get in front of you because there's going to be a lot of it, as I said, a lot of time in these meetings dedicated to the funding process. So, and what you don't see here is that once we get into it, there are multiple meetings during a couple of the months. So we will, when we come back in January, we'll have items such as that we'll be participating in the Greater Los Angeles Homeless Count in person this year, which is good news. We will, as I mentioned, bring that report on the contract savings and unspent funds. We're going to bring back this calendar. You're going to have had time to review it. And if you have thoughts and ideas for other items that you would like us to address, then that'll be the time to give some input. We will continue to report on the initiatives that fall under the purview of this commission, HIV Zero, Aging in Place, the poverty initiatives. So those, of course, will continue to be included in your work plan. So what's different and what we will bring to you next month along with this, we'll bring you the schedule for the RFP funding process and the related activities, because we're going to start in January. Staff is going to begin reaching out to all of the boards and a few of the commissions to begin getting input on what the priorities should be, what their input for priorities to highlight in the RFP. So we will begin to visit the boards in January and February, just introducing kind of a standard item for all of them to be thinking about what were the services, that they understand to be most needed by their constituencies, what's missing, what are the barriers. We will do that in January and February. And then in March, the very first time you see the social services program priorities with the 2022-25 funding process, we will be bringing representatives from the board to have a special meeting with the commission for you to interact directly with them to get their input on priorities for that funding process. So in March, that's kind of when you will begin to focus on the RFP and that funding process. It will from then on, it's kind of game on from then. April, we do have 2 meetings. We have a public hearing on social services priorities, which is exactly that. We will open it up to all the public to get their input on the same, similar. What are the needed services? What are the successes? What are the barriers? We will also be getting, if I step back a month before, you're going to get the report from the consultant who's doing the needs assessment of access to social services by community members of color. So this is all going to feed into that discussion, because we were also going to then in May, also in April, have a second meeting where you will kind of finalize your discussion about priorities, and we will bring the 2022 RFP document to you for your approval. That goes to council after you, because in May, we actually release the RFP to the community for them to begin to work on their proposals. So 2 meetings in April. We have, as I mentioned, we released the RFP in May. We will have the deadline for the RFPs will be the beginning of June. The Human Services Commission receives all the applications. We usually have an average of between 45 and 55 applications. You will be given, it's going to be, a lot of it just electronic this year, but you will be given all of those applications to review. And then in June, you'll have an opportunity, throughout the process, you'll have the opportunity to ask questions about the applications, to get answers from the providers. We'll have 1 meeting in June where you can kind of wrap that up with any questions you have about the applications. Then in July is a big month. There are 3 meetings in July. We have sorry, and it's not here. Sorry, hold on 1 second. In July, we have the one last opportunity for the commission to review the RFPs. We have the next meeting is a public hearing where our staff presents its recommendations for funding. And then the third final meeting is for us to come back and to receive input from the commission on staff's recommendations, if there's any kind of alterations to that, as we try to get a unified recommendation to go to council, which will be in September.
David, before you go on, what did you say was missing in July?
So in July, there's 3 meetings. And so the first meeting is one last opportunity for the Human Services Commission to review the applications. The second meeting is for staff to make the recommendations. That's also a public hearing to hear one last time from the public. And then the third meeting is for the commission to come back, provide any suggested revisions, and or agree with staff on the recommendations, which we will go, once finalized, we'll go to council in September. So as I said, I just kind of wanted to get this in front of you. As I said, you'll still get all of the kind of annualized reports according to the initiatives, the mid-year, the year end. You will also, we'll still have all the programming that's related to HIV Prevention Month, to Disabilities Awareness Month, Senior Month, World AIDS Day. But this is the draft that you have in front of you. So if you have an opportunity, please review it, come back next month with questions. And certainly, as I said, there will be opportunities for us to add to this and to address items that the commission, additional items that the commission would like to see on the work plan calendar. So with that, if there are any questions?
Vice Chair Meltzer.
If we have any additional ideas, do we bring those back next month? Is that the plan?
I would bring them back next month so you can get the consent of the body. They
Okay,
agree
thank
with
you.
it.
Can I get a full screen so I can see which commissioners are raising their hands, please? I did see Commissioner Freiberg.
Yeah, I just wanted to know if there were any, do we have the dates of these meetings? Just so I can.
So I will bring back the finalized RFP schedule and the dates for the commission meetings next month.
Any other commissioners?
I'm just curious real quick on why World AIDS Day is in November and not December.
It's just the programming. We want to bring the programming to you ahead of time, so you're.
I see. Okay,
Yeah.
thank you.
Yeah.
Thank you.
Anyone else? Okay.
Was already answered, so thank you.
Thanks. And nothing from excluded consent. Items from staff? Anything from staff?
So just real quick, first, I just wanted to say thank you to all the commissioners for your participation in the World AIDS Day event, which I want to thank you. I want to thank staff. It's always, it's a great event and it continues to be. And just very much appreciate your participation. And with that said, we also wanted to push out, again, if you have not been able to complete one of the surveys on stigma, we would love for you to do that. Jenny, if you have the slide that you can share for folks to see, if you're able to push out the survey on stigma to your followers, we would very much appreciate it. We will be collecting surveys through the month of December, and as much participation as we can get is appreciated. I also wanted to mention that on the Monday's council agenda on December 20th, the city has the opportunity to opt in to the national opioid settlement, which is
yes,
kind of fits in with tonight's presentation. So there's two settlements for various opioid distributors. The first settlement is with Amerisource Bergen, Cardinal Health, and McKesson. And then the second settlement is with Janssen, which is Johnson & Johnson. So the city has the opportunity to participate in that. The potential, these are approximations, but if the city goes through with that, it could bring a total of about $208,000 to the city. That would be spread over, I think it's 8 or 9 years. It's approximately $11,000 a year, and it will go towards, they have prescribed uses for the funds, but prevention and education, want to look into if there's an opportunity to purchase supplies for our agencies, such as Being Alive, that has a syringe services program. So more details to come, but it's on the council. It's just consent calendar on December 20th. But if you're interested in speaking to it, please do. So those were my 2 items. Les, did you have anything?
I do not. Thank you.
Thank you.
All right, commissioner comments. I believe I'm going to start with Commissioner Sandrick tonight.
Hi, everyone. I just want to share with you all, I'll be stepping down from the Human Service Commission, and tonight will be my last meeting. It has just really been an honor to serve the West Hollywood community for the past 7 years with my fellow commissioners, past and present. I'm proud of our work in launching Aging in Place, developing a robust street outreach program, making PEP and PrEP more accessible, and of course, getting through the great pandemic while uplifting our community. So this is not a goodbye. I will remain an active and engaged citizen, and will join you in the public comment segment. And I just also want to say thanks to our super smart and dedicated staff, David, Leslie, Derek, and his cat, Joan, Katie, and our former commissioner, Elizabeth Anderson, who's on staff and not here tonight. It's just been a pleasure to work with you all and serve the city. But I'll be seeing you on the other side. Thank you.
Thank you, Commissioner Shandrick. Oh, boy. Anyone else would like to go next? Please put your hand up so I could see it.
I've got,
Put your hand up so I could see it, Stephen. Thank you.
you want the little one like Commissioner Byers? I can,
No, I want you to put your hand up before you yell your words out.
okay. As a commissioner, I went to the AIDS Substance Abuse and AIDS Substance Abuse Services Consortium or whatever. Derek ran it, used to be David, and this was the first one they'd had in a long time. And it was, of course, virtual. There was a lot of very good information in it, including all the things that you saw tonight from Being Alive. Was very impressed with it, and it was a well-run meeting. I think this was Dee's first meeting, or I'm not sure. But anyway, Derek ran the meeting. It was well-run, and that went very well. Second, I'd like to close tonight's meeting in memory of Barbara Krupa. Barbara was a member of the Senior Advisory Board, and she was just, I don't know, I want to say lovely, but I use that word too often. She was a wonderful woman who, that if you asked her a question, you best be ready for the answer, because she really didn't pull any punches. She was very good, clean, fun. And I don't know, I miss her already. It's only been a month, and it's somebody I talk to on a regular basis. And she was from New York City, and definitely kept New York in her. So it was it's a loss to the city, as so many other losses are to the city. And lastly, I would like David Nash's comment about the setting up agencies or coming up with a way that there's not so much duplicated paperwork, which is very difficult for people with mental health problems, with substance abuse problems. You name them, we've got them. And I've been thinking about this. I've wanted to say something about this. I've personally experienced a couple of intakes that were just were actually pretty horrific. And I think Mr. Nash's suggestion is a good one. I hope we can take some, what is it called? Something from it and look forward to the future of having some type of database. I'm an HIV positive man, and I retired, and I cannot tell you how many times my doctor and I have had to interface to get a form for the same thing over and over again when I'm doing it across several different organizations. Everybody needs a copy of everything. So I think David really pointed to something that might help streamline us on that. And on that, I will say that I'm sorry to see Mr. Shandrick leave. Patrick, it's been a pleasure. I'm what are you calling it? And I hope I will run into you sometime during the regular course of the day. Thank you all very much.
Thank you, Stephen. Commissioner Davis. Anyone else? Who's next? Everybody's quiet tonight. Commissioner Byers.
Thank you, Chair Palmieri. First, I just want to wish all the best to Commissioner Shandrick. I'm really grateful for the opportunity to serve alongside you and thankful for your years of service on this commission beyond my time. I wanted to say I'm really proud to have supported and participated in several events for World AIDS Day, including the Paul Stark Warrior Awards. And congratulations to the staff and Chair Palmieri and Vice Chair Meltzer on your efforts that night. It was a really well-run awards presentation. I wanted to thank Katie. I had the opportunity to tour Essentia I think it was just this past month. It's been a long one, and meet with the staff there to better understand the operations of the agency. And I was just really impressed and grateful to Katie for setting up that opportunity for myself and Commissioner Freiberg and Council Member Seppi Shine, who participated in that tour. It's just a small group of us, and it was really fantastic. I traveled by bus to the agency, and while car commute isn't totally terrible, it's like 25 minutes away. I was pretty surprised that the bus trip was pretty enduring. It was one transfer, but like, so 2 buses, and it took about an hour and 20 minutes to get there and then back. So I just want to mention that as we think about and understand the networking of our services and folks who would require those services transporting themselves from West Hollywood or not. I wanted to also raise up the public comment about streamlining service applications. I just thought that was such a brilliant understanding of ways that we could better serve our community. And it made me also think back to a question I had asked a few months ago when I noticed that there were gaps in applications submitted versus applications that were awarded or given services. And I don't specifically remember what the instance was, but it made me wonder why some applications were submitted and then not given the services that they were asked. And just thinking, about where people may misstep or go wrong on these applications, where gaps occur, where people fall through them. And we're putting sort of the burden of work onto somebody who's asking for help from the city. And I just sort of wondered if there's other, in addition to streamlining, if there's staff capacity available to people to assist them as they fill out those applications, and city staff, maybe not, individual nonprofit agency staff, but just questions that I'll bring back to more formal questions when we have that type of conversation in January. But yeah, I just wanted to underline that public comment. And then I also wanted to thank staff for looking into my question about whether or not block by block security ambassadors are trained on Narcan and Naloxone administration. I know that there's just discussions at work in the city about expanding those services and, transforming law enforcement or police response in the city to more of a network community of care. And I think it's really imperative that those security ambassadors are equipped with that life-saving tool as they're out in community. That's all I think from me tonight. I took a lot of notes. Thank you.
Thanks so much, Commissioner Byers. Anyone else? Commissioner Darvish?
Okay, I'll go really quick. I wanted for all of us to recognize the National Human Rights Month in December. That's universal and national here. So just as someone that has come from a country that's like the worst violator of human rights, this is really close to me. I had experience through my family, my father, my sisters that were violated, and myself. And I think I said in New York, they would be on the phone listening to my conversation with my mother, just asking anything about the government. But I know almost all of you probably raised here, so it may not be that close to your heart. But if you experience that kind of act from a government that is the worst example of human rights, so and a country that actually created human rights back 3,000 years ago, so that's ironic for all of us to recognize what we have today may be lost tomorrow. The U.S. is only less than 300 years old, but just again, in this commission, I think we should recognize the month and celebrate the success that we've had in the U.S. as a country that people come to for freedom. I also wanted to thank Commissioner Chandrick. I'm really sad to see you go, and thank you for the service that you provided and the mentorship that from distance or just by watching you that you may not be aware of, but thank you so much.
Thank you, Commissioner Darvish. Vice Chair Meltzer.
Hi, Patrick. Patrick, we've been together for 7 years. Oh my goodness. I am sorry you're leaving, and I understand, but we will see each other. Stephen, Barbara Krupa was lovely. You can use that word. That's a good word. I just wanted to say how much I enjoyed working with Chair Palmieri on the Warrior Awards. It was, we had great fun. We worked very hard, but we had great fun, and I just love doing that. And I'm thankful that I was able to do that. Also on my LACOA commission, I am putting a panel together in case anybody is interested in attending, and it's called Renewing and Restoring in the Time of COVID, mentally and physically. So I will send the information to David, and David, hopefully you can send it out to other commissioners just in case they would like to attend. Thank you.
Absolutely. Thank you. I have a few things. First, I'm very sad that you're leaving, Patrick. I've loved working with you, and I've loved taking pictures at Pride with you for the last 7 years. Well, we missed 1 year, but, and you always brought a lot to the table, and I've always appreciated it. And you can ask Lauren, I've told her many times. You know, as far as what Mr. Nash said, I am in agreement, but I also know that we have case management that I'm hoping assists with some of the duplicitous paperwork, and I'm almost thinking they might, David.
They do. There's a lot of what he's bringing up it needs to be addressed. I want to tie it in real quick, and I'll be very fast, but you know, this has come up already with needs assessment, with social services for community members of color. We presented to the social justice task force. It was one of the first things that came up was, you know, going to an agency and getting a list of documentation that was needed and the challenges that creates. So I'm glad that Mr. Nash came today. We've had conversations outside of the meeting.
Great.
So yeah, there's many aspects to it, but it certainly needs to be addressed.
Stephen, I adored Barbara. She was one of the first people I met when I came on board, and she would text me or message me on Facebook about car problems and just yelling that she wishes she was in New York taking a subway. And I really liked her. You know, a lot of the great people were from a long time ago. The opioid dollars seem minuscule as compared to what havoc they've wreaked. You know, $11,000. Granted, it will help us, but it's not anywhere as what they have caused, and that's a shame. But I do hope that we get it. Boom is I once again want to bring up Boom, and I hope that you might check us out. It's in full swing. The boxes are going to be the party boxes are going to be a blast. The studio setups at the recovery center and at the sober homes it's going to be fun. The drag show and the DJ are top of the line. I think it might be fun. Listen, we're just going to try as best we can. Hopefully, maybe you'll tune in. As far as adjournments, we have Barbara Krupa. Anyone else had an adjournment? Joy?
I didn't have an adjournment. I just had just a few quick comments when you're done.
No, please go.
I just wanted to thank Commissioner Shandrick for his service. It's been short but sweet for us together, but we hope you come and visit us. I want to still request that every resident receive an N95 or KN95 mask just to keep on hand besides COVID and variants that keep coming around. We still have wildfire smoke that poses a great danger to people with asthma and other ailments that make it difficult to breathe. I hope the city continues to promote mental health services and keep expanding the services for people without homes. And I just want to wish everybody a happy holiday and a happy new year.
Happy holidays. All right, I don't have a gavel, but I have this. I don't know if you can see it. It's so glary it won't show up. One day during the pandemic, Lindsay was mayor and she came to my door and she said, I know you won't let me in, so will you come downstairs? And I went downstairs with a mask, gloves, eyeglasses, and everything wrapped around me. And she said, as mayor, I get to give people the key to the city. And there's an awful lot of queens in the city, but there's only one empress. So here is your scepter. So I'm going to be using this for our meetings.
to adjourn them, and I will see you next month. By the way, I think Stephen said he wanted August off, David.
I heard that as well.
I was going to say that I did notice that August is full. And how did we ever live without August all those years? Thank you, Jimmy. I'm glad.
Everybody have a great night, and thank you for tolerating what I was going through in the beginning. I'm really sorry.
Oh,
about
yeah.
that. Take care now.
All right. Good night.
Bye.